according to thy principles. And we say these things in the name of Jesus Christ. Amen.
Amen.
Please rise. If you're able.
Stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we have a little bit of a longer agenda today because well, we have a lot of items on here. So we'll begin the process of building our agenda. The way this works is anything that is not held for discussion is automatically approved on our consent agenda. So I don't have anything till item 27 on consent. Anything that folks want to hold before?
I think number 4 needs to be held for a report.
Okay.
And then it's been asked by the treasurer's office to continue number 14 for 1 week.
Continue 14 for 1 week. We will hold item number 4. Again, we're working off published consent agenda. Continue. Then I think we hold 27 for discussion.
Did you also say, did you say 20 as well? Or was it,
I did not say 20.
they said up to 20, okay, 27?
Okay, then we move to the regular agenda. And as we go through, feel free to announce any you'd like to hold. I actually had a question. I don't see item number 6. Is Dave Shawcroft on the line?
Yes, I am.
Ooh, with great picture. Hey, Dave. So is item number 6, I know that there were some procedures that were related to this meeting and some of the guidelines as Provo has gone to the orange phase. Is this necessary for us today? I think I'm getting confused with the written determination, and so I just want to make sure that this is still set to move forward.
It's still set to move forward. We ought to do it today, but what it does, it just incorporates the provisions of the current state law into our policy. It has no direct effect on what we are doing today by way of how this meeting was set up.
Got it. Okay. So I would actually like to hold number 13, but actually let's table that, if that's all right.
Can we hold number 12 as well, just for some comments there?
Hold 12. I think we should strike, I heard that we should strike regular agenda item number 16.
16.
Actually, let me get guidance. Strike or continue?
Strike it.
Go ahead and strike that.
Yvette had mentioned that group canceled.
Okay. We could hold number 25.
Okay.
Table number 31. Hold number 32.
33, I think we need some discussion on, but there's also a lot of scheduling with personnel in the county. I think we should table 33 as well.
And hold number 35.
Oh, and then the work session can be stricken. Okay. Anything else from you, Commissioner Ivy?
No, those were the items you covered that I had questions on, so we're good there.
And Commissioner Lee, you have all of the items noted?
Yep.
Okay. So we will go ahead and move to, the first item is published consent agenda, item number 4.
Is Elizabeth here? You Elizabeth? Okay. This is a report on one of the fee waivers that you did a little while ago.
Okay, great.
Sorry, the lingo gets a little confusing. I'm Elizabeth Sadowski. And we had our annual Labor Day pun run September 7th, so it was about a month ago. And it's a benefit for the Pregnancy Resource Center, and they're located in Salt Lake City, and they provide free resources and support to those facing a pregnancy crisis. And so this year was the 5th year that I set out to organize a race event. It was a 5K, 10K, and as it was kind of a weird year, we didn't hit our I can't think of the word right now. So last year we had 200 participants, and this year we ended up having 150, which I can't really complain about with all the circumstances of this year. But we're really grateful for the fee being waived. We again, this is for, nonprofit, so it's greatly appreciated.
Thank you.
Okay, thanks.
Sounds like a great event.
Okay, it looks like our next agenda item is consent number 27, which is to approve and authorize the signing of an agreement for the Saratoga Springs Marina Beach TRCC project as recommended by the Utah County Tourism Tax Advisory Board. I guess one introductory comment here on this item is earlier this year, actually it's been a long time, but I know that the entire commission has been focused on really getting priorities with the Tourism Tax Advisory Board. This tax revenue comes from restaurant and hotel tax, and it's meant to provide tourism and recreational related opportunities in the county. And a clear kind of priority came to the surface of really making sure that our canyons and outdoor recreational opportunities that are very unique to this county are appropriately managed and invested in. And one of those incredible assets is Utah Lake. And so this year, earlier in the year, the Tourism Tax Advisory Board approved a number of projects that are meant to bring more amenities to Utah Lake for all of our residents to really be able to enjoy and participate in. And there's a couple of them who are ready to move forward today, because each of those requirements or each of those approvals required local matching dollars from the cities that wanted to participate in this. And so I believe the first 2 cities are ready today. They've brought their own dollars and other grant money, and have asked for the county to match to really enhance the shorefront of Utah Lake. So with that, let's see, is there someone from Saratoga Springs here ready to speak to this item? So can we unmute Saratoga Springs City Manager? And while we're doing that, if you could just maybe speak to why you felt like it made sense to bring your matching dollars into this project and get the county's dollars, and how you feel like this will enhance the opportunities both for your residents of Saratoga Springs and for the residents of all of Utah County and even outside of that.
Commissioner, I need to know the name or phone number of the person who is in the Zoom meeting from Saratoga Springs.
Mark Christensen on the Zoom call.
He's waving right now.
Commissioner Ainge, this is Mark Christensen, City Manager for Saratoga Springs. Thank you very much for the opportunity to be able to visit with you briefly here today over Zoom. We are really excited about this project. For probably the last 15 to 20 years, the city has been working on building the marina that we have here in Saratoga Springs. We're very proud of it. It is one of those things that is one of those key features here in our community. We're very excited with the opportunity that this grant is going to allow. It's going to allow us to take basically the marina, which now only allows for boat access and personal watercrafts being launched into the marina, and this is going to create a second jetty, which will create a swim area and a beach, and it will create an area where we will have a lot more opportunity for people to come and enjoy and use the lake. As you as commissioners know, but for the audience that may not know, one of the things that our community has really focused on is how we can tie to our recreational amenities. And we see Utah Lake, which in our community is roughly 5 miles, 5 miles long worth of the coast of the lake that we have in our community. We've focused on that as one of the key things that we want to draw towards Saratoga Springs. One of the emphasis that we have as a council and our mayor and council have set as a priority is to tie to the recreational amenities here in the community. And our marina is certainly one of the prize possessions that we have. We've recently acquired additional lake property, which in coming years will become yet another marina here in Saratoga Springs. So we are fully committed to embrace the lake, pull the lake into the community, and have that become an integral part of the identity that we have as a community. I'd be happy to tackle other questions for you.
Thank you. I also see Eric Ellis from the Utah Lake Commission here. Do you have anything else to add on this project? And if so, even if it's brief, maybe if you could come up to the podium.
Thank you for providing this opportunity. I would add that the purpose behind the 3 or 2 different projects that we end up with was to provide a tourist option, a really beautiful interface with the lake on both the west, the east, and the north ends of Utah Lake, where most of the population is based. And so this is allowing that to move forward, and we are very excited about it as the Utah Lake Commission.
Thank you. Okay. Any other discussion on this topic?
Let me turn this on. Hi, Mark. Can you hear me?
Hello? Yes, I
We've
can.
had some discussion on this. I love the lake. I love what can be done there. And I'm fully in supportive of doing what we can with the lake. There is a concern, though, that I have, which I expressed to you as we had talked about, and that is our TRCC our tab board has historically only funded up to about 35% and not a 50% match. This match notion is kind of new. We had some discussion about that with the tab board. I'm a little nervous about that, especially with the years in which we have consistently held that line pretty consistent, even with the next talking about what can be done there. there is some concerns that I have in the county, and that's where this funding is and where we're at. We have been very good at trying to keep ourselves above water, and keeping ourselves above water means that we have to be prudent in what we're allocating out there. And so for me, in looking at this one here, trying to be consistent over the years in what we've done, I could support up to the 746,746, which would be about a 35% match. That way we can keep our consistency, and even with this next project, which, you know, they'll be able to talk about, they're significantly above that. And so again, I love that we're doing stuff along the lake, and we're trying to build that. But in talking with even some of the TAB board members, there's some hesitancy with a 50% match on it. And so I just wanted to make sure and express that I'm willing to go up to that one spot there.
I just want to note, I appreciate that Commissioner Lee has been able to do that in the past. It has allowed us to have a pool of funds that we were able to draw upon when significant opportunities came up, like the Provo Airport last year. And so I do think that is prudent. I do think we have a healthy reserve, and given the decline in tourism-related revenues for this year, I think one of the reasons why this has taken a little bit of a time to get on the agenda, following the TAB approval, I believe that happened very early in the year, is we wanted to revisit this notion of where the budget's at, and if they really wanted to reaffirm that. My understanding is that the board did reaffirm their desire for this to move forward, and they affirmed it at a 50% match level.
Well,
so, sorry, did you have a comment on that?
I don't know if, I mean, they reaffirmed the project itself, but from my understanding on there was some hesitancy. There was a ranking process that we went through with there, and I think they were leaving it open, especially considering that we have done 35% in the past. And my fear is that as soon as we go to 50, then everyone's going to come in at the 50, and no longer will we be at 35. And so I am concerned. We do have reserves there. But if we look at all the projects that are out there, they start to chop down pretty quick, and so I am concerned about breaking from our past on this and going higher. I think we should be consistent with what we've been doing.
Yep. And I certainly respect that. I also acknowledge that there's been a lot of work done from these cities, and they've kind of relied upon where the guidance has been this year at 50%. And so on that basis, I'm comfortable moving forward with the contract as drafted. So I don't know if we want to have more discussion. I would entertain a motion on this item.
Well, I'll make a motion. I'll make a motion that we approve and authorize the signing of the agreement for the Saratoga Springs Marina Beach TRCC project with the amount of $746,746.35 dollars. I don't know if Commissioner Ivey, is he on still? Are you there, Commissioner? Are you there, Commissioner Ivey?
Commissioner Ivey, any comment from your end? We can suspend the rules here. I can make a motion. Commissioner Ivey.
Sorry, I
Commissioner
was
Ivey has a
second that motion. I apologize. I'm having a little trouble. I can't unmute myself to speak. So I actually like to stay where we've historically been on our matching with this, and therefore would second Commissioner Lee's motion.
Okay. Here is my hesitancy. We should move forward. I'm going to move forward with that. We have a motion and a second. I guess my comment would be that we can approve this contract. It will still be, obviously, it depends upon the funds coming together. This has a total budget. And so, you know, I know that Saratoga Springs has worked up to this point, and so, anyway, they'll have to come up with the difference, or we can have further discussion. But we have a motion and a second to approve the contract as modified in Commissioner Lee's motion. All in favor, say aye.
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 You have to re-invite him. Boy.
Still need to hear your vote, Commissioner Ivy? Well, we could always move forward because it has a 2-0 vote with one abstaining due to technical difficulties. Okay.
Mr. Chair, can I ask a question? I see Reed Dixon on here. I don't know if he realizes that 1, 2, and 3 on our agenda went through on consent. I didn't know if there was any question to that or not, but so I'm just wondering, Reed, if you had any questions. That the Vivian Park Road stuff it went through.
Oh, okay. Can you hear me?
Yep.
Oh, thank you for unmuting. I just wanted to make sure there was only one clarification. I think the new document talks about the 2-year issue. I think Robert maybe fixed that very recently, and I wanted to make sure that was in the approved version.
I saw it. I believe I saw it in there. I don't know if, I mean, I know that was discussed.
There are actually two places where the funds have to be spent in 2 years, and we have to show proof of how they were spent in 2 years. There's 2 different places where it mentions the time frame.
Okay.
It's hard to do it on a computer when you got the Zoom on it, but
Do we have?
is Robert on there?
This is Dave Shawcroft.
Yep.
Rob's on the line. If you can unmute him, he can address that.
Rob, you there?
I'm here. Yes, that is resolved. It's been attached. The most recent document attached today does have 2 years in both locations.
Great.
Okay, thank you very much.
Okay. Commissioner Lee, I know that you just referred to another item that's not out of order, but I know there are maybe people here to talk about that. Do you have any desire to do that out of order, or just keep moving through this?
There's people here to talk about the road?
No,
Road
no,
issue?
no, the other lake project.
Oh, do you want to, yeah, you bet. We can
Want to
do
move that forward?
Sure.
You can go ahead and introduce that one.
Okay. So we have another lake project. This one is in Vineyard. It's a waterfront project. The mayor, city manager are here, and I don't know if others are not, but I see the two anyway. This is a project, again, we want to support what's going on along the lake. We see that as a jewel of the county, and we've got a couple of cities that are trying to embrace that. And so with that, I'm going to just turn it over to the mayor or Jacob or whoever. Come on up and speak to your project. Again, this is with TRCC, Tourism, Recreational, Cultural Arts, and Convention Center, that tax money.
Okay, thank you for having us here today. So we have a similar lake project. Yes, my name is Julie Fulmer, and I serve as the mayor in Vineyard. So anyway, we have a lake project that expands across our entire city, and we've been really focused on it, making it public so that residents and tourists within the region and outside of the region have access to this area. We've had several projects that surround the area that you see before you tonight that we're placing matching funds on. So we have about $3 million going to the south portion of the beach area, another $1.5 million going to the north, $20 million going to the east, and I believe $150,000 going to trail improvements to connect the entire area together. Our goal is to integrate this TOD that is right along the beachfront into this area that allows restaurants, hotels, cultural centers, convention centers to be connected to this tourist location and really provide a beautiful area along the lake. And part of the feature is this promenade that's a green space that will have things like bioswales that will clean the storm water that's going in to make sure that the lake remains clean, and really focusing on aspects to make that jewel of the county that you mentioned a beautiful area. And so that's some of our goals to integrate that. One of the really unique features about this area is that a front runner station will be at the east side of the transit-oriented development and will lead right into the beach area that walks down this promenade. And so that's a exciting aspect of it. Jake, did you have anything to add?
Yeah, my name is Jacob McCarg. I'm the city manager for Vineyard. Just to echo the mayor's comments, this is a large transit-oriented development that is facing the lake. We're embracing the lake in our development. And as she mentioned, we have a large park that will run directly from the train station to the lake, and it will provide recreational opportunities to people outside Utah County. So it'll be one area that can drive traffic from outside the county and pull people down to recreate here. We're going to have hotels and restaurants lining that park and then lining the shoreline as well. So we've got a lot of exciting plans, and as the mayor mentioned, we have a lot of matching funds that are being contributed from the city as well as the developer that's doing this large TOD. Yeah, and they're here as well.
Oh, they are?
So
Okay.
one question I have to Commissioner Lee's point about the match. In the other contract that we just approved, it actually stated the matching dollars that are required from the local municipality. And so this one just had a dollar amount. It's $2.9 million going to the waterfront project. And so can you speak to, and I felt like we needed to make sure we acknowledged or required that match.
Yeah.
Because I know that as part of the application process, that match was promised. And so can you maybe speak to those contributions
Yeah,
that you would
absolutely.
call the match that have already taken place or that will continue to be taking place?
Yeah, so a portion of it's already done. But what we have planned right now, between the developer and the city, our matching funds are $24,940,000. The city's contributing $17 million of that, and the developer is contributing $8 million of that. And that Mayor Fulmer talked about the three projects: the park to the south, the area to the north, and then a trail that connects those two, and then that large park that runs from the train station to that Vineyard Beach. And the Vineyard Beach currently exists, and it's an area that's getting more traffic now, but will just increase when we bring that connectivity north and south and from the train station when it opens.
Got it.
And this is, this project ranked really high, with our tab board. It was one that, and the reason why is that it hit a lot of the components that we were looking at in the way of tourism, especially with that front runner station coming down. It has a big draw and a big pull to it, and so it's exciting to see it. Plus, obviously, the match on that thing is significant, I think that, you're doing it in stages, and we get that. There's stages, there's a first stage, second and third stage to it as you're drawing it down. But I think it will have quite a draw, especially when we talk about TRCC monies and how possibly some of that funding will go to. It doesn't always have to, but it does. This one has the ability to do a lot of replenishing back into this account as well, which I think that the tab board and others, and myself included, feel like it ranked pretty high because of what it will do in the future.
Yeah, we're definitely hoping for that as well, because that means good things for Vineyard, so.
Thank you.
Same opportunity as Eric Ellis from Utah Lake Commission. Any additional comments on this project? Nope, he's good to go. Okay, any more discussion up here? As we prepare for a vote on this one, just in the spirit of over-disclosure, I'll note that I have a extended relative who is not a beneficiary, that this project goes on public property, the city of Vineyard or state, but the neighboring property owners certainly benefit from these amenities going in. And I have my cousin's husband is one of the minority owners of some of that property. But again, this is through a long list of lake projects that we're approving and is good for our community in my opinion. So I'm more than happy to move forward with the vote.
I'll make a motion that we approve and authorize the signing of the agreement for the Vineyard waterfront property as stated in number 2 on our agenda.
Second.
We have a motion and a second to approve this item. All in favor say aye.
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 That passes 3-0. Okay, let's see, what are we at now on our agenda?
Oh yeah, we went back to. Oh yeah, this one's number 12.
Well, 12, oh, we held it, yep.
I just want it on this one. I don't know who's going to speak to this one.
This is Dave Shawcroft. Adam Beck is also on the line. But this is just to clarify, quite often when we get grammar requests, those are typically handled through our office. And quite often the classification of those documents is made after we receive that request. And this would just clarify that when we receive those, we make that classification, and that will clarify that process under the county code provision.
So can you give me an example of that?
Sure. I mean, hypothetically,
Yeah.
The county has a grammar portal, and so a grammar request will come in to the portal, and typically Laura Mendoza in our office will pull that off of the portal and then proceed with the process to respond to the grammar request. And sometimes those that request will ask for a document that contains private information, social security numbers, for instance, or a home address or phone number. And then law in consultation with the attorneys in our office would respond to that request, typically by redacting that confidential information. But the document itself is not classified per se under GRAMA until that request is received. And so this just documents what that process is and how the determination is made.
Oh, I see. Okay, so it's just so you can classify it so that we can eventually give that out.
Right.
Okay. Yeah, that makes sense. It was kind of confusing when I was looking through it, so that helps. Thank you. Thanks, Dave.
Good.
I wouldn't mind, I don't know if this is timely. If there's no objection, I think I would request a continuation of this item. Is there any timeliness to this?
No, there's no urgency on this. We could put
It's
this
just-
on a work session if you'd like.
Well, it's just cleanup, and I think that there's been a number of just kind of, a couple other procedural questions about the grandma process that, I would like to discuss with your office prior to voting on this one.
Okay.
Okay.
Yeah, we could just continue it for, well, a week from now is another regular meeting, so if you want to continue a week, have that conversation in the meantime.
Okay. No objection. I'd continue.
Sounds good to me.
Entertain a motion on this one.
I'll make a motion that we continue item number 12 for 1 week.
Second.
We have a motion and a second to continue. All in favor, say aye.
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 Okay. I believe that takes us to item 25 on the agenda.
Okay, number 25. We had some budget meetings this morning, and so I had a chance to talk with Under Sheriff Sean Buffton a little bit about this, and I did some follow-up from that meeting. And it appears, and I don't know, that's the reason why I'm going to ask, and you're probably on the spot a little bit about this, and if we need to continue, we can.
Okay.
On the funding side of this, I have no problem with the machine. I know exactly what you're trying to get with it. I'm for what we're doing there. But looking at the monies for this, there was $70,000, I think, for that machine, if I'm not mistaken.
Right, yeah,
Something of that
70
nature.
and change, I think, something like that.
Yeah, in doing a scan of the budget, part of the problem is I hesitate every time to use salary and benefits, for items for widgets, or in this case, this machine. And so in looking at your budget, I'm just wondering, there's $16,356 available in ammunition. Usually we purchase that at the first of the year for the whole year, but there's about 16,000 in there. And then in the travel, and the reason why I'm just bringing these up, because I don't know what you need to do or what's in there, but there's $112,000 in travel that's also in the account, and I just don't know what you're going to do from here to the end. And I'm wondering if we could take some of that money and transfer it to offset some of this.
With the ammunition money will be spent. A lot of times we'll do 2 orders, and so that ammunition is going to be planned for. The travel, obviously with COVID this year, there was some issues, but we are bringing some people in, like our discussion today. Instead of us going out, we're bringing trainers in. So right now, I couldn't give you an exact number, because we've still got several months to go yet.
Okay.
I guess my plea would be, this machine is critical right now for us to prosecute, or not prosecute, but to investigate crimes, child sex crimes, trafficking, child trafficking, sex trafficking, drug cases, fraud cases, and it is to its limit. I mean, one sex crimes case with multiple, maybe hours of video could overload it. And so, and we are critical right now, and we're at a critical time to even get it here, before the end of the year. So that's why.
Could we pass this with an understanding that you'll look at that budget and see if there's some of that money that you're going to be using, and then what's not, we can roll it back and then move forward. Because and then I would be fine with taking what we can out of the 1100 account, because I do think this machine is needed and necessary.
Yeah.
That's not the issue. The issue is just on the funding side.
Yeah, I think that we would gladly do that if the travel and the training ends up that we can take it out of there and roll it back. I don't think there's any issue with that at all.
Okay.
I think what I'm also hearing is, even if it's just a portion of that,
right,
and then it's a portion that still comes out of 1100, then we can get this paid for.
Yeah.
And get you the equipment that you need.
It is a critical piece of equipment for us to investigate all these kind of nasty crimes. So.
Okay, thank you.
Thank you for that explanation. entertain a motion on this item.
I'll make a motion that we approve and authorize the commission chair to sign the agreement as stated in number 25, with the understanding that the monies to pay for this we will look at excess money that possibly might be in other accounts, including also including travel or other accounts, and what is not then picked up can be funded through the salaries and benefits portion, the 1100 account.
I will second that.
We have a motion and a second on item number 25. All in favor, say aye.
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 That passes 3-0. Okay, I believe that takes us to item number 35. Sorry, is there another one? Yeah, 35?
35.
Okay. I'm happy to make some introductory comments to this as we ratify or propose to ratify this execution of the health order. You know, I think I'll give a little bit of background. Early on in this process, as this pandemic began, I was a voice for being mindful of the costs on both sides, the human costs and the economic costs of shutdown versus the costs of COVID-19. And you know, I think we jumped in to support the private sector and the business community and the restaurant community. And as we began to reopen, all three commissioners and all of the mayors signed on to a letter that really encouraged and asked all of the members of our community to follow the guidelines from the state and to wear masks when they're in public. Then we experienced a post-Memorial Day spike, and that's when we actually had a series of public hearings, or we had a public hearing here where we had members from the medical community, from IHC, we had their hospital administrator and infectious disease specialists come and speak to us. We also had a medical doctor who had some views that differed from CDC and differed from IHC, give a little bit of a contrarian view to some of the data and spoke about limitations of masks. We listened to that dialogue. We had discussion from the public in that meeting, and this is all on record. And you know, at that time, there were requests for us to wear masks. We encouraged wearing masks. We did not make it a requirement. And then we moved forward, and throughout the summer, Utah County had one of the most open, best performing economies in America, and also had one of the lowest hospital utilization rates. So from my perspective, that's a pretty good place to be. And this latest spike, however, raised new concerns. For the first time, we had members of the state task force asking for immediate intervention. And my approach has not been to ignore medical experts, but to follow their guidance and also listen to feedback from a lot of different voices. I valued the perspective of the other commissioners. I carefully listened to our sheriff about his enforcement concerns. I listened to all of the mayors. I listened to Mayor Kafusi. She had a valuable perspective because they had been through this process. And in fact, we had these calls open to the public and the media. Ben Winslow pretty much live tweeted a lot of our deliberations. Amelia Powers, a great leader in the county, someone who I admire and respect and have worked closely with for the last 2 years. I listened carefully to her, and while we disagree on the ultimate requirements, much of her feedback influenced how we were very accommodating of exceptions and disabilities. And of course, we had hundreds of emails and calls, which we listened to and read from our residents. So there's been a lot of discussion, even public discussion, as we got through to this topic. But finally, when the governor moved Provo and Orem back to the orange phase and indicated that really our entire county could move back to the orange phase if we didn't act together and in concert with them, and asked for a mask requirement as soon as possible, along with the rest of the state task force, I was willing to follow that direction and guidance from the medical experts, and timing was of the essence. And so we went ahead and issued this order, and together with our local health director, Ralph Clegg. So that's some context. Now it's back on our agenda for ratification, and I certainly would turn it over to, before we take any public comment, to comment from other commissioners and our health director, if you'd like to.
I'll happily speak, Commissioner Ainge, for a moment. This was one of those situations for me where you're in between a rock and a hard place. I had a very poignant and direct conversation with the governor's office, and they made it clear from my understanding of our conversation that we could take action and have a public health order requiring masks to be worn when social distancing wasn't available, or our county could move back to orange. I was unwilling to put our local businesses, restaurants, and others who have already suffered great economic loss as a result of restrictions in orange and red standards to have to fall back into that because we didn't take a small step. I don't like mandates, but this is one of those situations where I felt this was a lesser of two evils, and so I was supportive of this. I was disappointed that the Tuesday meeting was canceled. I will note that I did not sign off on the cancellation of that meeting, as was publicly commented. Commissioner Lee and Commissioner Ainge acted together to cancel that meeting. I have valued the public's input on this, and it's been very split publicly on this issue all the way through. And for me, this was a decision based on keeping the county from falling back into orange to try and protect the businesses and other entities so that they continue to function. And that's why I was supportive of this, was to try and keep the county from going orange after conversations with the governor's office. That's my comment.
Thank you, Commissioners. Ralph Clegg with Utah County Health Department. I appreciate this opportunity. As we were looking at, as the governor moved us back to orange and we were looking at the surging of cases and concerns associated with that for Utah County, there were very few things that we could do very few arrows in our quiver, I guess, that we could pull out to try to address this issue, short of doing some things that may affect our economy a little more dramatically. And so I was willing at that point to use the authority granted to me under the state law to issue this masking order or this masking requirement if the county commission was willing to support that, which my understanding was that was 2-1 in support of that, and so I was willing to support that. But masks have been shown to be effective in slowing the spread of this virus. We've never been, from the very first, that I have not been very strongly, I have not tried to strongly enforce additional requirements. I've gone with what the governor has recommended, and so I can continue to be that way. I don't want to go overboard with any of the things that we may take into consideration here, but I'm willing to support this mask mandate at this point. So. Thank you.
Thanks, Ralph. And as you mentioned to me, you were looking for at least a majority of the commission to move in that direction, and as you also have mentioned to me, that if there was a change where there was 2 commissioners that wanted to take that mask mandate off, you'd probably go that direction as well, understanding that it is your decision. But you've made that to me. I want to make sure that's still correct. Yeah. So this, we can go over. I'm not really to talk about masks or not masks with this. This is a ratification on this on the letter. The problem is as I see it in this ratification, is that it has been used in an inappropriate way, and it's been used in such a way that I think is detrimental to our process, and it's detrimental to our working relationship when it comes to ratification. Ratification is usually something done on contracts. It's pretty it's usually an easy thing to go through. In this case, and Commissioner Ivey, I want to acknowledge, because I can feel that you're sensitive about that, and I think it probably needs to be clarified. You were not one that signed off on canceling the meeting. I was one of those that said, okay, I'm in favor of going forward, but it has to come with some context here. Commissioner Ainge and I had a conversation, and in that conversation, the thought was, well, we need to cancel this meeting because there's going to be people showing up, and we are not ready. We still need more collaboration. We still need more discussion. We had a meeting with the mayors. The mayors basically were saying they don't like the word mandate. They wanted a little softer language on there. Excuse me. And so with that verbal understanding that we were going to have more dialogue and more participation and more collaboration throughout our county, I said, okay, you know what? I know it's a sensitive topic. I'm willing to say let's move it to a different time in which we can have more discussion. Then the next day comes around, and next thing I know, after the governor's meeting, I get this email saying, hey, we got this mask mandate in place. 2 county commissioners have already signed off on the letter on it with Ralph Clegg on the letter portion. And so it looks like it's moving forward. I then wanted to interject and actually sent some emails saying I could probably support this letter if there was some tweaking to it. That was the last I heard. Until the next morning, when I was informed that we had a mask mandate in place. I think this is very detrimental to our ratification process. It feels like it was a rammed through process. And it does not feel like it was one in which we have dialogue and conversation, and that's why you saw after the mandate went out there and the letter went out there, there was a subsequent letter the next day that came from my office, because every member of this body should have some sort of voice in what is done and how we participate with that. That voice that I had there was not allowed to go forward, and so I had to put a letter out afterwards to clarify where I was at on this issue. That's where I think we start getting ourselves into trouble, is when we're it felt like it moved in a direction that I don't think it should be, and I think that the ratification process, and especially that was already moving before our meeting that was canceled even was coming up at 3 o'clock. I mean, there was discussions about it. So I understand Commissioner Ainge and I did have some conversations about this. He said, basically I went over to his office and he said, things change, Bill, things change. And I guess they do, but I feel like this ratification process is problematic if we can't go through a process in which is collaborative with all of us, and it feels like it's being used to thwart conversation, and especially public conversation, where we can look at, because let me back up. The ratification process, again, ratifies things without deliberation, without conversation, and without public comment. And that in an issue like this, to me, is problematic on just the face of it. Now, if it's something that we all agree to really on a ratification, it seems easy that we can go through it. But again, having the ability to say, what about this? What about that? This ratification is a real lower form of governance. And I think it should be used rarely. And in this case, I think it was abused and not held to a standard which I think we as a commission body should hold that standard. So I will be voting, obviously I'll be voting no on the ratification.
Okay, thank you for those comments. I certainly could respect anyone who has a view that they want more deliberation. As a couple of clarification points, as I kind of stated in my open remarks, there was a lot of deliberation. I feel like everyone in the governor's office, every mayor in this county, every commissioner, Members of the attorney's staff had access to those deliberations, those conversations, so it was a very public process where everyone was included to have a voice. You know, Commissioner Lee, you referenced that you marked up the letter, so you certainly had an opportunity to express your opinion. You know, those may not have been incorporated, so, you know, you got outvoted, but that doesn't necessarily mean that you didn't have a voice. But your broader point is one that you wanted more deliberation and more public deliberation, which I certainly respect. As it goes to things changing, with the meeting being canceled, things changed a great deal. We were in communication with the mayors. We all thought that there was a chance that if Utah County passed some local regulation, we could avoid any action from the state, moving any of Utah County back to orange. And so we didn't know if that item that was ready to be heard on Tuesday was something that would influence the state, if it was something that the mayors or a majority of the commission was ready to support. We didn't know. And that's at the time we canceled that meeting. Late at lunch the next day, for the very first time, the governor put Provo and Orem to orange and asked for us to immediately act, to do something. Specifically requested, as did Dr. Dunn and Rich Saunders, that we should put a mask requirement in place, and that sooner better than later. And so a ratification process, it does make less opportunity for deliberation, although we're doing that today, but it does allow for action when action is required and when it's timely. So we can have a difference of opinion on that, but certainly all of this was available to the public. There was a lot of deliberation, and ultimately we took this action.
Mr. Chair, do we have a policy and practice in this county that we could actually hold an emergency meeting if needed and necessary?
We do.
That was not used. Second, the governor never called me. I had requests in for him to call. He never called me. Of course, it's at his discretion how he wants to do that. But yet in his press conference, he even mentioned the commissioners can come up to his office, or he can come down to our offices, and we can have face-to-face conversations. That has never happened as of yet. You know, with the deliberation and consultation and being able to speak to it. And so, you know, it's again, in my opinion, when we look at ratification, and especially going through a process like this, we should be deliberate what we're doing. And it felt like, again, it happened even when we had that on the agenda and the commission meeting was canceled for it. We could have easily just strike the issue, but it's out of, for me, it's completely out of bounds when we use it in such a manner like that. When we have other processes in place for emergency meetings that can happen, if it's such an emergency, why not hold an emergency meeting and go through the regular normal order of business instead of doing a ratification afterwards? It seems completely out of line to me.
Okay. Thank you. I guess we can turn it over to some public comment now on this topic. I know there are people here and perhaps on the Zoom call who would like to comment. Procedure, I could speak to procedure, but Josh, could you maybe talk to how we want to handle this in person or for those commenting on Zoom calls? We open public comment.
Sure. So anybody on the Zoom call who would like to make comment can use the raise hand feature in Zoom. And if you've raised your hand, then I'll assume you want to comment. I'll keep track of who those are. I'll let you know, and we'll call on those individuals when that time comes. I would advise that perhaps you take the in-person comment here, or at least a couple, perhaps give the overflow the opportunity for a couple comments. Maybe we go online for a couple, and we could kind of rotate that way. But I can certainly keep track of those on Zoom that have raised their hand that would like to comment on Zoom, and when that happens, I can enable that.
Okay. And we have a 3-minute time limit for the comment. Okay, so we'll start with those who are here in this room. Do you have a public comment?
First, my name is Stephanie Grant, but Tanner, I kind of think you're rewriting history a little bit here with when you're saying that how many chances you've given us to speak, listen to the public. This is my third attempt in this room just to have you listen to us, and you keep canceling meeting after meeting after meeting. And I'm wondering why our views keep changing so much. Can Ivy hear me right now too? Is he on? Okay. So I have.
Yes, I can.
Okay, thanks. So Ivy, at our last meeting, well, it wasn't really a meeting, the one that we had to just kind of come in, that was canceled. You said you would never support a mask mandate, and here we are with you signing off on these papers. And Ainge, you told me and my sister that you're not the person to talk to about the mask stuff, that you have no power over this. But you are the guy who's signing off on this for our kids. And you and your wife also are the ones watching your kids' sporting events without the masks, while our kids are being forced to keep them on their faces. And the governor's the one having parties for himself. He's up on stage dancing with everybody without his mask, and our little kids are the ones that are suffering. Our little kids need those off their faces. You don't understand the emotional effects that are happening to our kids. They need to see each other. They need to see smiles. They need to have interactions. What are we raising? Right now they're socially developing. So what's going to happen to them when they grow up? We're teaching them to be scared of sick people. We're teaching them to not show compassion. We're teaching them to keep arm's length away from everybody, to look at everybody like a walking virus. We're dehumanizing our children. Masks have always been viewed as scary for kids. And now we send our kindergartners to school with masks, but we as adults, I really don't care about the adult issue, because people can't force me to wear a mask. I'm not going to wear a mask. But people are forcing my kids to wear a mask, and it's not okay. It's not okay for our little ones to see that. I had a cousin commit suicide 3 years ago, and from outward appearance, he was happy, tons of friends on the football team. He's not somebody you would think is suffering. But yet we still miss the signs. Now I think about the kids that are suffering. How are we going to even see them through the mask? Think about adults. When you walk around town, I don't know if you've experienced, but people don't hold the door for me. Guys usually are super nice and hold the door. Now people are just trying to stay away from each other. People don't connect. I'm not connecting with people in stores, anywhere I go. It's not, we're isolating each other. People aren't very friendly, and because everyone has an opinion about a mask. But I'm telling you, it's time we have to stand up for the kids. The adults aren't even wearing them, but our kids, they're in them the entire day. It's not safe for them. They're little bacteria-filled things, and our kids need bacteria. They need to be exposed. They're going to have weakened immune systems.
Thank you for your comments. Stephanie, just a couple of responses. Well, and that's okay. You feel free to take a seat. Canceled meetings. There was one meeting that was canceled.
No, two.
Where people were here.
I was here for both of those.
So what was the one that you were here for that was canceled?
I was here the first time where you decided to cancel it before you came in.
Well, when I decided,
with your mask down,
when I came in, that the room had not followed the guidelines.
They give us an option to follow your guidelines.
Right. Well, it was already non-compliance. Okay, so that one on July 15th.
But let's back up to that one. You had roped off all the rows. So you said we weren't socially distancing, but there wasn't every other row marked off. Every single row was marked off. So we honestly didn't think it was for social. I moved the tape. I didn't even think it was for. I thought it was oh, maybe these are just reserved. I guess we can sit here. I did not even think it was.
So I don't need to necessarily believe there was any bad intent on anyone's part.
Why didn't you let us have the meeting?
But the reality was, in my opinion, that room was not safe and not following the guidelines at that time, and so we canceled that meeting.
But when Bill asked us to, Bill kindly said, "Hey, we need to make this safe." Everybody who was standing left. Everybody left and gave everybody else a chance to talk, and then they left and let people in. You didn't even ask people to do it. Everybody peacefully did it, walked out peacefully. You just said, it's canceled, I'm done. And then the governor said, these people are foolish. And then you guys took pictures of us and put it everywhere and blasted how dumb we are.
Well, it wasn't us, it was the media, but
This right here, one of them, like, yeah, you guys
he's
blasted
from the
us.
newspaper, so.
Right, and your comments blasted us too afterwards.
So,
You did a number on us.
that's your perspective. I was just trying to keep the room safe, but, so that meeting was
And ask
canceled.
us to.
What's the other room? Or what's the
The other
meeting?
meeting, when we came here and you said, oh, it's been taken off the agenda, and then you had technical difficulties, so,
So that meeting wasn't canceled, and Commissioner Lee took it off the agenda.
okay, so we had showed up here to have a conversation with you, and you told us, because we didn't know it was off the agenda till we got here, but then you told us like so many times that, I'm not here to talk to you about this, we're not here to talk to you about this, as soon as this meeting's over, you guys are gonna be forced to leave. Like, that's not a very accommodating
Sure.
standpoint to listen to the public.
So I understand. Again, Commissioner Lee put that on the agenda, and Commissioner Lee took that off the agenda.
Mm-hmm.
And people yelled and screamed at that meeting, saying, "No, we don't believe you. You took it off." Commissioner Lee admitted, no, he's the one who took it off.
Okay.
So just want to clarify that.
Okay.
Well, I
So-
mean, your office put it on, which it shouldn't have been put on in the first place because it was an item that I had, but yes, okay.
Okay, it was continued from the previous meeting.
Well, no. Continue can go for a long time. It wasn't continued for 1 week. And so usually the agenda item, the presenter on that is the one that gets to determine if it goes on or not. If it's continued for a date and time, then it goes on for that date and time. That was continued. It was your office actually took it and put it on when I requested that it not be on for that meeting.
So that's actually not accurate. My office did not put it on.
Well,
What did
who put it on then?
So it may have been the clerk auditor who continued it because they thought it was required,
No.
or the civil division.
Sorry,
But
you're
it
wrong.
certainly was not at direction of my office.
It came, Alice called Ezra, and Ezra asked for it to be put on.
What does the governor say to change your
So-
guys' minds?
That's not accurate. Secondly,
You can ask Alice.
when you said that I had indicated to you, Stephanie, and others that it was not my role, I also want to separate these two items, okay?
Yeah.
So that meeting where,
Yeah.
we got canceled, that was about masks in schools. That is not our role. We still have not done anything as it relates to masks in schools.
But apparently you have a lot more power than you're telling us, because you just helped push through this mandate for our whole county. So if you have that kind of power, which you didn't think you did, you definitely could be a voice to help get the mask off our children, right?
So no, well, again,
Or
you asked
you're
me,
the one.
at that time, there was a discussion about masks in schools. We did not have a mask requirement in Utah County. We had nothing to do with the masks in school conversation.
But
So
now-
that's what I told you at the time, and that was accurate. And guess what? Even this order still does not impact the school mask requirements. That's separate, issued by the state school board and the
Do you think
state.
you could help us get the masks off our children? It doesn't matter. You know how you said, Clegg, you said you're trying to not get things shut down with masks? Well, it doesn't matter if there's a mask on, because my daughter is wearing a mask in school, and she's not sick, and she just barely got off of quarantine because somebody close by her, that's not even 6 feet away, somebody in the classroom tested positive, who's not even sick also, because we've increased our testing by 40%, I think that's what you said. And so, like, it doesn't matter if there's a mask on their face or not, you're still shutting things down. So, like, what's the point of the mask, you know? If it's, you're making them quarantine regardless. So can you help get those off our kids?
So
You guys talk to the governor regularly, the way you guys have met, you brought up the governor like 15 times in this conversation. You guys could speak to him. You represent our community.
So there's no question you're right about that.
Yeah,
I just,
speak
so,
to
so
him.
we could certainly, in our individual capacities, lobby state. And so that's why I think it's appropriate for you to reach out. I just wanted, but.
Who? To you?
Well, you could reach out to them. You could reach out to us and say, will you help us? But I was just clarifying that this body has no action to take as it relates to masks in schools.
But you can help us, right?
Certainly, as we can help be a voice to causes at other levels of government. So
I don't get how, I don't understand. I wish Ivy could speak. I'm wondering how he could take such a stark change in his views from saying he would never support a mask mandate to, can he speak for himself on that? what
I'm sorry. I felt like I addressed that in my comments, but I'll be happy to address them again
Yeah, I know.
with a reminder that this is a public comment section and not necessarily a section for debate. So I'm interested in hearing the public's comment. But I will once again reemphasize
Sounds good.
my position here. In my conversation with the governor's office, it was made very clear that if we did not act quickly, as in a day, okay, very quickly, that they would move the county to orange. And I think it's important people recognize what that does to us.
Aren't
Right?
already in
That's
orange
putting
though?
restrictions back onto rest. No, we're in yellow. We were in a very positive yellow, almost a green, until we had this latest spike. And so we would be falling back with heavy restrictions on businesses, restaurants, and other industries that are crucial. Or I could say, okay, we should wear a mask when we're not social distancing. Make sure that it's not a criminal offense, so you're not getting a misdemeanor for not following a public health order, which was put into this language, and take a action to try and prevent our county from falling into the state mandated restrictions of orange.
Or you
And
could
that
take
was
a
the
stand
decision
for
I
us.
had to make.
Or you could be a
Pardon?
voice for the people, and you could represent the people who don't want masks on, and it's been proven they're not even working. If you're saying our numbers are going up and so many people are wearing a mask,
Okay, so here's the problem with what I'm trying to express to you is I had a decision to make. I could follow the governor's request and issue a public health order, or the governor could put us under further restrictions. I felt it was in the best interest of the broad citizens of this county to not be put under further restriction because we felt the economic suffering when those restrictions come.
I can understand
And so
what
I
you're
felt
saying.
like this measure was the rational measure for me to take. Is it my ideological measure? No. But do I feel like fighting a lawsuit with the governor and while he still puts us into orange and all these restrictions are in place was in the best interest of the public and your tax dollars? No, I didn't
Yes,
feel that way.
that is the best
And-
interest
and so I
representing
made
us.
what I felt was a rational decision to try and keep us from falling back into orange. And I respect someone who disagrees with that, who says, nope, you should have made a stand, you should have sued the governor, blah, blah, blah. I can respect that. I did what I felt was in the broadest, best interest for the citizens of the county to keep us from further restrictions falling upon us.
You did what was the easiest thing
That's
to
why,
do. That was the easiest. The hard thing is to stand up for us.
you know what,
That's
ma'am?
easiest.
I appreciate you, and I appreciate your perspective on it, and I can assure you that it was not an easy decision. I can assure you that I made a decision to try and keep the county from falling under heavier restrictions.
Okay, thank you.
That's what I did.
For this public comment. I'm taking Commissioner Ivy's hint as well that, we'll move back into the comment period, less back and forth, and so more people can have the opportunity to address us. So next person who'd like to speak.
Okay, so with 3 minutes. So you said to Bill Lee that, Aaron Davidson, American Fork. You said that things change. We're a country of law. We're not a country of do what you want because things change. There's code in the procedure to make changes, and that was not followed properly.
Sorry, do you want to speak to?
Ralph Clegg was up here, and he said that, he made the decision based upon his understanding that you guys would go along with it, and you guys said that you'd go along with it if the health department would go along with it. That's not a way to make a decision, because then you can just pass the buck on to somebody else. The state law says that the governor has to have legislative action in order to renew a state of emergency. That continuance was not given, and so that action by the governor was carried out solely on his will to do it, which is it's not with the rule of law. So he's already outside the rule of law, and now he's telling you to do something that he doesn't even have the ability to do. And so you're listening to a governor that's going outside of the rule of law, so you're going outside the rule of law, And any mandate coming from the commission says that you have to have open public discussion, which you're having now. But as Stephanie said, that was canceled twice on us. We had a room full. We were here. We had hundreds of people here. And you just canceled it on us. Again, as Stephanie said, you didn't give us an opportunity. And if you look at the photo, I'm the tall guy standing right there on the side. Okay? I was there. And you came in and just canceled it. And then after you left, Bill Lee said, okay, let's kind of make it safer in here. And half of us left. And then when we made comments, we left and somebody else came in. Let me turn this laughing off. So I don't believe that right now that mandate that was sent out last week, you didn't have the right as a commission to even sign that letter because you hadn't had public discussion. So you shouldn't have your signature on that letter issued by the health department. And we talked with Ralph Clegg and the health commission on Monday, and we had some really good discussions about rule of law and how us as parents, and also we discussed the difference of age group and brackets. There's been 3 deaths in 0 to 18 in the state of Utah. That 0.003% of all of that age bracket has been affected to a serious degree. Yes, there's been illnesses. And then also, I don't know if you know, do you know the technicality of how the PCR test works?
A little bit, not much.
No, you need to. Okay, so there's cycles in the PCR test, and anything above 30 cycles starts amplifying the minutest DNA fragment to test positive. And if the testing lab goes anywhere from 32 to 35 cycles, they're going to find any coronavirus is a cold. And coronavirus has been around for a long time. Coronavirus 19 or COVID-19 hasn't been, but coronavirus is. And those coronaviruses in the past can show up as positives. 77 NFL players were tested positive about 3 weeks ago. They retested them with a different lab. They all came back negative. So we know that there's some false negatives. So all this emphasis on cases rather than deaths or hospitalizations is purely, it's not valid. There's no way. I know my time is up. So
thank you for your comments.
Those are my comments. And you said you look like you had a question.
No, that's fine. Thank you, Aaron. Couple of clarifications that I would make is, because this is helpful. I've heard a lot of citizen feedback about that. Don't emphasize case counts. And we have looked at the data in totality, as has the state. When they required or asked for immediate intervention, it was not just based on a spike in cases. It was looking at the rate of case growth, which was 5.4 times higher than anywhere else. They were looking at the rate of positivity, which was incredibly high in Utah County, specifically in Provo and Orem. And they were very mindful of hospitalization rate and trying to project what this current spike would do to hospitalization rate. And so we certainly are looking at everything in totality.
Yeah, but as stated in the discussion on Monday, Ralph Clegg said that the testing in Utah County is like 40% higher than all the other counties. So if you start looking at correlation, testing is higher, positive cases are higher. If you start looking at correlations, they say correlation is not causation, which you can argue that for or against. But if you're going to test and start pushing test, which they do at all the Intermountain Healthcare Centers, they're pushing testing in this county, you're going to get more you're going to get more positives, and no one's tracking to whether those positive cases actually turn into symptomatic cases. So the emphasis on case count is completely ridiculous. And
Thank you for your comments.
I've got to go.
Okay. And then I'll just pause for a minute. Dave Shawcroft, if you are prepared, I don't know if you are, but it would be helpful if you could comment on the rule of law and the authority of the county commission to act by ratification, or specifically in this instance.
Sure, I'll be glad to address that. With regard to ratification, once you have two commissioners taking action or proposing to take action, that then will becomes effective upon the ratification of that action, and that's why any time that we're involved in some, so for instance, we have a contract that
Sorry,
needs to be
Dave.
signed immediately.
Dave, we're having a hard time. You might need to restart. I don't know what's going on with your audio.
Can you hear me now?
Yes.
I was just saying, with regard to ratification, anytime we do that, it's not the preferred method. We do it rarely. But if it is a situation that requires some immediate action, then that's done, and it is immediately then put onto the next commission meeting so that it can be ratified and be made effective to so that it then is effective, in fact, and it cannot be challenged, because even if there was some alleged defect in formality upon the ratification, that is cured, so then it becomes effective.
So Dave, since we're on that topic, the typical process that we have in the county is that the ratification process goes through an attorney in your office. And
Correct.
typically it is not communicated, between the commissioners during this ratification process, because the attorney is that conduit between the commissioners, and so like you said, it's one that we probably should use rarely, and I would fully agree with that. I'm not challenging that the ratification process or there's anything illegal necessary that was done, but what I am challenging is that the next day after this happened, I called Mr. Levitt, and I said, Mr. Levitt, I've got a problem here in which it says on this thing the commission, did this letter, and it's going to have to go through the ratification process, and I've had people text me and email me saying, hey, the commission did this, and yet my signature is not on the bottom. And I said, there's something wrong with that, which he agreed, and I know you got a phone call from him basically saying that when that happens, the attorney does not represent the majority of the commission, but there should be the commission involved in this whole process, not outside of that. And that's where we've got some problem. That's where I'm really having some problems with this, is that there was some initial conversation that went on. I even submitted some thought processes into what we could do with that letter, and in hopes that we would probably have some more discussion with mayors. But yet one commissioner was seemingly cut out of this process, this ratification process, and not allowed to have, in my case, my opinion put into a letter that would go out to the public. And so, again, the ratification process, I'm not challenging that it can be done, with two, but when you go around this process, and it was done all the way into the night. I mean, that wasn't done till like 8 or 9 o'clock at night. And we do have emergency meetings that we can set up. We did have the governor say, hey, we need to meet, let's go meet, we can sit down, we can have this, they can come here, I can go there, whatever the case is. That didn't happen. It just looks really bad for ratification when you start using it in that manner.
Okay. Commissioner Lee, just one point, just so you're aware, earlier this year there was this letter that you had signed, maybe it was last year, and it came for ratification. It was a letter that I didn't really have a chance to agree with, and it came to the agenda, so I was okay with it going on ratification. But later on, what happened was, it was actually had the letterhead that had Commissioner Ivey's name and my name on there. And so this time around, we actually made sure that that was not the case, since you were not part of approving this. We knew that you would be frustrated if it had the letterhead that had all three on there. But I still struggle to kind of understand the objection of, it's like when we hear the U.S. Senate pass something today, that doesn't mean that everybody, unless they say passed it unanimously, then that means everyone. But if the Senate passed something or approved something, it means a majority or whatever the requisite approval was. And so
That's not the issue.
I don't necessarily understand. I hear all your other concerns. Those have been documented, valuable. But I actually would like to understand what your concern is when because you expressed an issue with us saying that the commission had done something. And if the majority of the commission does something, I believe that is the commission acting.
Yeah, I mean, you're taking it down into a smaller rabbit hole on this whole issue, but nevertheless, again, from talking with David Levitt, who talked with Dave Shawcroft, who talked with Ben Van Oy, he expressed to him that as the attorney, you represent the entire commission, meaning all three of us, not just the majority. And so in representing all three of us, it's important to have that dialogue and that conversation if you're going to be the conduit. The other option, the other part of this is that as the chair, it's a function also to make sure that everyone is involved and knows what's going on. For a member of this body to find out about it on a news feed the next morning is unbelievable. It's unbelievable considering that there was dialogue, or there was an email that went back and there was no other communication after that. It just went blank. That's where it starts to get really fuzzy, especially on a ratification process, if you want to tie it to, and I don't know which one you're referring to in the past, but
I just think it was the emergency, it was to do with the fires or the grant money from the federal government.
yeah, we have to look into that. I mean, that's whatever on that. We can look at that and see what that is. Actually, I think, well, we can look into it, but I believe that one at the time, and Dave can correct me or not, but there was something in which the chair at that point in time could sign it. So, I mean, yeah, if your name was on it, we could change it. But
Which is
there
why I
was a
didn't take any issue of
ratification
ratifying
process.
it at that time.
Yeah, because Dave said, actually, this is a determination by the chair and the chair only. It's not a ratification process with all the commissioners. There's a fine difference between the two. So, anyway, again, we can keep going on this forever and ever, and I don't think it's going to change any minds with it. It's just that I fully intend on working with the civil division to put some policy in place, especially when we have emergency meeting opportunity and declaration, conversation where the governor on a public meeting said we probably should meet. You would anticipate from something like that we'd at least have that kind of conversation and dialogue, and I don't think, and it did not happen, and it will not happen. I would be shocked if now the governor wants to come down and meet with us, or us to go up and meet with him.
Okay, thank you. Okay, do we have additional public comment?
All right. My name is Marianne Nilsson. I'm the one that started the Provo referendum to stop the Provo mask mandate. I understand the Utah County mandate or health order is superseded by the Provo's mask policy. So this the health order does not actually apply to Provo currently. However, as soon as we get the signatures required to stop the Provo mandate, I suppose that we will then fall underneath the Utah County order. And I have submitted a referendum to the county clerk, which they should be giving to whoever needs to address that, as well as the health department. However, I've been told that by them that since the health order came from an administrative body and not a lawmaking legislative body, that the Utah Constitution, which allows you to get a referendum to stop any type of ordinance, it does not apply. And so we still submitted it in case there's some way that we can still get that to go through, and we're seeking legal consultation. However, I'm concerned that this avenue that's been provided for the government to pass orders and laws could very quickly turn into other things that are also very intrusive on our rights as citizens, such as a vaccine mandate. And I am upset about the mask mandate as it is right now, but we're going to be pushing back in any way we can find. And there's a lot of people that are very upset about this, and we're going to find out ways that we can communicate with you. I know there are many that want to meet with you, Tanner. They'd like to set up appointments to talk with you. That we were trying to figure out if we can call your secretary, if you take appointments from the public. There's a lot of people who feel that their emails are being disregarded, and I know that there are people picketing your home currently. I'm not one of those people, but people feel frustrated. They don't know how to get their, they don't feel that they're being listened to, and they want to feel that you are listening to them. Do you take appointments by phone appointment?
I do. There's hundreds of residents across this county, even those who have sent pretty scathing emails, who know that they get a civil call back from me, and that I'm happy to engage on the issues. I meet with them in my office. Had a number of those conversations this week. I will note a couple of things about the timing of this. I returned back from military training the weekend before this happened. Also, my assistant and his wife had their very first child at the same time, and so there's been some leave. And at the same time, over the last few days, as everyone can attest, the county has installed a new phone system, which are sometimes working and sometimes not at the moment. But I have gotten back to a number. I get back to a lot. I'm happy to sit down and meet with folks, especially those who are not the ones who just send, sometimes there was one person who said, "I'm surprised you don't respond." When I look at their email, and it was basically, I probably shouldn't say these words out loud, but telling me what I can go do to myself, right? And so I don't understand. I just figured that all they want to do is express their frustration and not reach out. I certainly don't respond to all of those emails. But if people want to set up a call and talk, there's many out there who know that I respond. I'm happy to do the same.
Okay, all right, thank you. And if I have time, do I have any time to say anything else, or am I out of time? Okay. I just wanted to say that it's unconstitutional for the government to mandate medical treatment of any kind, which includes forcing us to wear masks, under any circumstance on any individual or their dependents, even if there's a legislation that claims to have created this power. In a federal court ruling in Pennsylvania this year, Judge William Strickman said, "Even in an emergency, the authority of government is not unfettered. The liberties protected by the Constitution are not fair-weathered freedoms, in place when times are good, but able to be cast aside in times of trouble. There is no question that this country has faced and will face emergencies of every sort, but the solution to a national crisis can never be permitted to supersede the commitment to individual liberty that stands as the foundation of the American experiment. The Constitution cannot accept the concept of a new normal where the basic liberties of the people can be subordinated to open-ended emergency mitigation measures. Rather, the Constitution sets certain lines that may not be crossed, even in an emergency." And so, anyway, with that, I'll yield my time. Thank you.
Thank you for your comments and participation.
Can I make one more comment just for the record? I do not condone any type of malicious or mean-spirited protest in any fashion, and especially on family members. I think that's completely out of bounds. I do believe that we have a right to go to our elected officials and find redress and have conversation, and I think that there is appropriate times and places for that to happen, and the hope is always that as elected officials we're willing to have those conversations, even if they're tough conversations. I had an individual pounding on my door at one time. I opened it up and I said, "Come on in." He was red-faced. He was pretty upset about an issue, and we sat down and had a conversation. I think we need to have that kind of conversation, even though it's, it can be hard. I mean, things happen. I get, cheese. I didn't know cheese was so destructive until it's thrown all over your car. And then, you try to get that stuff off. It's like concrete. You have cheese, or you have egg your house, or, single finger salutes and stuff like that are going on. But still, we're in a pandemic. We're in a time. Let's talk to each other. Let's have conversation. Let's find ways, because that's the strength of who we are in this community, is that we love each other, we know our neighbors, we volunteer, we want to help. We want to help each other. We want to do it in a way that makes sense. I wish that we were as effective with this coronavirus as we are when it comes to when we have snow on the mountaintops and it turns sunny all of a sudden, like in 1983, and all that water came down and we rallied together. We have got to come together on these issues. We've got to find ways to do it. We're going to have disagreements. I'm upset about that ratification process, but I will stand with Tanner and with Nathan under any kind of persecuting situations and say that's wrong. Let's not go there. Let's have conversation. Let's have dialogue. And the more, the better on these issues. And let's not try to exclude or try to, manipulate certain areas so that we can go down a certain path. Let's do better. Let's do better than what we're doing.
Thank you. Okay, any additional public comment? Okay,
So, Commissioner, might I suggest that we go to 2 comments on Zoom that had raised their hands fairly early on, and then go to the overflow room?
Sure.
Okay. I'm going to go ahead and turn the webcam on here and display the timer. And the first comment we'll hear in just a moment will be, it's Brittany Lindsay on the Zoom, and I'll unmute her in just a moment. Okay, so that's the 3-minute timer, which we will use for the overflow room and for the Zoom comments. And I'm going to go ahead and invite Brittany Lindsay to unmute for her comment.
Hi there, can you hear me?
We've got you.
Awesome. Thanks for inviting public comment on this meeting. We really appreciate it. A few of us, a lot of people are really upset about what's going on, because although no one likes their family being attacked, our families are being attacked. And what's sad is that we're not all public officials, so we elect you guys to be our public officials. And when you say we're attacking you and your families, you're attacking us and our families by not standing up for what we're trying to represent for our kids. And a few of us have tried to reach out to you, Tanner, in a pretty polite fashion. We came and stood outside of your home a couple of times. I don't know if you were there both times, but I know that one time it was a Sunday, and I'm pretty certain you were home and some doors were shut and windows were opened, and it was just kind of funny. We kind of hoped that you would come out and talk to us. We were just waving, and it wasn't a riot. We weren't being disrespectful. We don't want to hurt you. We want to talk to you. We are hoping that you can stand up for our families. We see your wife out there at that football game, and she's rooting your kids on. We want to be able to root our kids on. It's not fair. The double standard is not fair. Okay? I'm sure that you're a great person. I'm sure Ivy is. I'm sure all of these people that have their own opinions. We're all great people in our own spheres, but what we're doing to kids is not okay. And I am just a little appalled that we're saying that we're coming after you and your family when you're coming after our families with the way that you're voting and mandating. That's coming after our families. That's coming after my kids and my babies. I see you kind of looking around, and I don't know if I'm like up on my time, but that's pretty much all I wanted to say. Thank you for listening. Say hi, Arabelle.
Hi, Mommy.
Hey, baby.
Can you?
All right, sorry, I'm done. How do I unmute it?
Mommy, can you make
Hold
that
on, baby.
about?
Hold on, baby.
Okay, appreciate that public comment. We could keep going. I'll make a quick clarification there. This came out over the weekend, and so I'm happy to clarify. There's no restriction. I mean, Provo and Orem have their own standards. I think even youth sports parents can still attend. Certainly where my wife and I are up in North Utah County, all parents and even other adults and family members, friends are allowed to attend youth football games, youth sports. Certainly we're going to be there cheering our kids on. So there was a misunderstanding that somehow that was restricted. It's not. The mask requirement simply says, hey, if you're going to go and you can't socially distance, then wear a mask. And so that's what we did. We go and cheer them on. And my wife is someone who, she went there, she put on her mask. She had her mask when she got there. She had her mask when she left. She set up a chair that was away from the other parents. And yeah, at one point, I think when folks were taking a picture, another parent came over and had a conversation with her. Like, I think this is what we don't want to do. I don't know if the photo analyst went and got a measuring stick to decide if that person was 5 or 7 feet away from my wife. Like, that's what we don't want. So we should all be doing our best, follow these guidelines. That's what me and my family are doing. But thank you, appreciate your public comments.
Okay, the next comment in the queue online is going to be Adam Garside. I'm going to go ahead and ask Adam to unmute.
So this is actually Ashley Garside. For some reason, I could not change the name.
Go ahead, Ashley.
I am completely opposed to the mandate in general for the entire county. However, my concern is the fact that the increase in cases is actually in Provo and Orem. And I don't see how that affects people who are in Eagle Mountain or Alpine or anywhere else that really, I don't go to Orem or Provo even weekly. So I just have a problem with the fact that it's going to be county-wide when I'm in Eagle Mountain, and those increasing cases do not affect me. And that's all I have to say.
Really appreciate your comment, Ashley. I'm happy to respond. I don't know if anyone else wants to. I think that's, respect your opinion. Also share some of your concerns there. As we've spoken with the state health department, as you track the data, the challenge is, and one thing you didn't say, but often goes along with the point that you just made is, okay, it's isolated to Provo and Orem. It doesn't affect me out in Eagle Mountain or Alpine. But also, hey, these people where it is, it's kind of focused around Brigham Young University and Utah Valley University. And these younger student populations are not experiencing severe symptoms and not being hospitalized at a normal rate. It's an incredibly low rate. So why are we concerned? And I think that goes hand in hand with your concerns. And what the state health department and state task force shared with us is this is just so incredibly difficult to isolate. While that is one of the major contributors, is this younger population, it's already not isolated to that in our county, and it is spreading to the point where Alpine, I can't recall Eagle Mountains off the top of my head, but even some of our more remote areas like Alpine do have a high rate of positivity right now. And we're also seeing an increase, not just in our student population, but in other areas. So that was kind of the goal, I think, of what the state was trying to do in coordinating their action of taking Provo and Orem to orange, and also asking for a county-wide intervention, is saying, hey, we're going to identify the hotspot, but we also need the whole county working together to try to make sure this doesn't spread and make the entire county a hotspot. Because certainly you might not be coming in and out, but there is a lot of transfer between the cities, as we all know, and even just among the students, they go home and see family and friends. So that's some of the rationale, but I certainly appreciate your concern and comment.
Yeah, this is the part that drives me crazy about this, because blanket mandates drawn by artificial lines, we call it county lines, and we have cities like Eureka that are just barely outside of our county, but come over all the time, and yet we have these blanket mandates in place in for the entire county, and you look on the map and you say, wow, that out there in some of those Goshen and Genola areas, even some in Eagle Mountain and others, there's hardly anything that's going on out there, and yet a blanket mandate, that's in place all the way across. It doesn't make sense. It doesn't make sense. Of course, when you put Provo and Orem into an orange status, and yet everyone. Again, that's just an artificial line that's put across those two areas. It almost seems punitive to do that instead of collaborative and cooperative, because the people are going to go to American Fork, or they're going to go to Pleasant Grove or Linden or Vineyard, and they're living right there. But all of a sudden, here becomes these artificial lines that are put into place, and that's where I think people get really bent out of shape when we start doing blanket mandates like that are really hard to follow and really hard to see. Now all of a sudden you got to have a mask. Now you don't have to have a mask. Now out here, you do. It becomes unenforceable and the lowest level of compliance on a force level, instead of trying to find cooperation and education.
Okay, commissioners, we're going to go to the HJB conference room, the overflow, for a series of comments from those that are there physically. Their camera has been started. I'm going to unmute them in a moment. Let me just remind people that if you're on Zoom as a call-in person with your phone, you can use the star and then 9 keys to raise your hand. So that's the asterisk button and then the number 9, and that's how you can raise your hand for comment. Otherwise, there should be a button to raise your hand if you're in the Zoom to get into the comment queue. I'd advise that we go to all of the individuals waiting in the overflow conference room one at a time. Just reminding folks to state their name for the record for each comment. I'll go ahead and invite you to unmute, and just go ahead and keep the overflow unmuted until the comments are done.
You ready for me? Can you hear me over there okay?
We can hear you fine.
Awesome. My name's Allison Morris. I am from Linden, Utah, and I have just a couple quick things to say. My profession is in sanitation, and I mean, the mask mandate is totally unconstitutional, but I think overall we are forgetting the true screw up here. It is not the government's job to save us from anything. The proper role of government is to get out of our way so we can live our lives and make our own decisions as adults and Americans. It is not, I don't expect anything, any safety, anything. I want the government out of my way so I can make choices that is my inherent right to do so, okay? The county is freaked out that the governor is saying this and that and orange, blah, blah, blah. The governor shouldn't even be doing that either. It's not his job to do this. And I can tell you, I am not the only person with this message. I just happen to be here getting a babysitter because I'm a single mom who works, okay? I do not have a choice to take my kids out and homeschool or private school, all right? My money is taken for Alpine School District regardless of what I want to do with my kids' education. And now they're forced to wear a mask all day. When I take them in the morning and they cry, listen, I've had enough sanitation classes to know that those masks are not saving you from anything. Mr. Ainge, you've touched yours dozens of times. It's so contaminated, okay? This is incredibly frustrating because we are given zero choice in this. Oh, no, I can choose. What, can I get a ticket? Can I get arrested? Can I be shamed? Yes. But nothing's going to change because we're under a tyrannical decision here from the governor. Shouldn't be doing that anyway, okay? So we are asking you to just get out of our way. Allow us to decide how to take care of our health, how to live our lives, and how we'd like to proceed from here on out. We are adults. We are Americans who know how we want to live. So we are asking you to stop this, stand up for us. Let's be a leader in Utah and show people, here is how you live as a free people. Here is how you exercise your liberty. Can we do that, please? Can you do that for us? Any one of you could answer. I'd love to hear from Mr. Lee. I'm a big fan. I met your brother in Smith a couple times. He's the greatest. Anyways, Mr. H, speak up though. It's hard to hear your muffled with your mask on. Can you stand up for us and get out of our way? Let us live our lives as Americans, free people. We don't need to be protected. If you know the proper role of government, you know the governor is out of line a million miles, right?
Thank you for your comments.
Welcome. I love to see my tax dollars at work. He's not going to answer you. Can you answer? Will you stand up for us and get out of our way and let us live our lives and decide on our own?
Appreciate your comments, and we have others who'd like to make comments. Certainly, I think we do have a difference of opinion on the role of government in terms of, I do believe.
My opinion is a constitutionally based opinion. The only opinion anyone serving in government should have.
Okay, thank you.
There's a typo on here, by the way. Pun run. I'm not going to wear a mask for that. Can I run out or is someone else?
The other guy's in control.
Can I go?
I think you're up over there.
Am I? Okay, great. So my name is Laura Hackey, and I just want to say that over 6 months ago when this started, there was a lot of fear-mongering going on. There was TV, media, people, I don't know if you're posting on the screen, I can't see that, but people were just laying in the road like they were dead, just dropping dead like flies. And then this mask mandate was the state of emergency came into place. But over 6 months later, we can see that is not the case now. That's not the case. And what is happening is that there is a carrot being dangled in front of us, saying, if you do this, well, you go back to your life. If you do this, you can go back to your life. And but no matter what, it never leads us back to our lives. It just takes us further and further into a dystopian nightmare. And then the other, if you don't follow the carrot, the other path is that you get threatened. You get threatened to go into orange. You get threatened to get shut down. And so no matter what road you take, we're heading into a dystopian nightmare. And I just want to say that we need to look at more information. So you said that you're here to gather a lot of facts, scientific facts, but I don't feel like we're getting all of the facts. I know that there are a lot of great scientists, doctors that have been censored. Let's talk about Dr. Bartlett, who had a treatment that was working. He's a very highly reputable, very accredited doctor who has been censored. Dr. Scott Atlas, he is the coronavirus task advisor for the United States of America. Why are we not listening to him? Why are some scientist voices and some medical voices being censored? That's a question I want answered. Because I want to, will you look into that? I want some time back because you're just not answering. You're just sitting there, and my time is being wasted, and I have more things to say.
Well, this is a public comment period. It's not necessarily a Q&A period.
Okay, but you did say that you would be willing to talk to the people,
yeah.
And I assume that would be like a conversation where you would answer back.
Well, I'm certainly happy to. The county certainly has not censored any medical opinions or any scientific research. So, no.
So, are we going to be looking at Dr. Scott Atlas? Are we going to be looking at Dr. Bartlett? Are we going to be looking at asymptomatic versus symptomatic? Are we going to be looking at death versus cold symptoms? Are we going to be looking at how many are hospitalizations? The hospitals are not overwhelmed. This is actually not a pandemic. It's a case-demic. A lot of information that has been spoken today has been incorrect. And I just want to set the record straight. I know that actually when you said that your wife was at the thing and she didn't wear a mask for a second, it was actually the whole game. I wasn't there. Someone texted me as soon as you said that. They sent me a text saying, no, it was the whole game. There's a picture circulating of you at a basketball game, not wearing a mask, and other people are, and the ref went to you and spoke to you and said, put your mask on, and you refused. Now, don't get me wrong, because I don't have a problem with that, because we shouldn't have to be forced into masks, but I can see that you don't believe in it either. I can see that, and it seems hypocritical to force our little children, all of our children, into masks. And the reason we talk about our freedoms, they shouldn't be disregarded because it's like as if we're Americans talking about our freedoms, they're being disregarded like, oh, it's your freedoms. But no, actually, these freedoms are affecting us personally. They're hurting our children. This is why we care about our freedoms, because without caring about these American freedoms, our lives will personally be hurt, and right now our children are hurting. And including with this Utah County mask mandate, because like I said, every step forward is another step into this dystopian nightmare. And so
And that is time for the comments. Do we have additional individuals that are in line to comment at the overflow location?
No, there's no more waiting. I feel like he just cut me off, though. Like he just literally. Louder. Why are you going to stand over there or yell at me?
Yeah, the comments.
Yeah, I feel like he just.
The comments
cut
are
me off.
limited to 3 minutes apiece.
So you don't have any more time to talk to the public?
Okay, we have a number of individuals who are online that would like to comment, that have raised their hands. Again, just as a reminder, if you're on the Zoom and you want to comment, you can push the button to raise your hand. If you've called in, you can push *9 to raise your hand. The next person in line online is Aaron Bolin. Aaron, I will unmute you here in a moment so you can begin your comment.
One thing, Josh, just in case anyone is having any problems with the raise hand feature, they could also use the chat feature to just send a chat that they'd like to comment.
That's a good point. I will go ahead and enable the chat feature here in a moment so that individuals can do that. Okay, Aaron, you can go ahead.
Hi, am I on?
We can hear you fine.
All right. Thanks. So, as with most people here, I'm not a big fan of this mask mandate. I think, originally, like with the 2 weeks to slow the spread, I was kind of, germophobic, and I was trying to do my best to do that. I think over time, I've definitely evolved on how I've been treating the pandemic. But basically, what we're trying to do is, our goal, essentially what it looks like is like 0 cases before a vaccine that's supposedly going to make us all so we don't get the disease. I don't think that's a great way to live. And I think that we need to look at, more finer tuned data and, not just generalities. So basically we had a high case count in Utah County, and the governor threatened to make us orange. And so instead of going to orange, we decided to do a mask mandate. But the funny thing is, all the cases were in the Provo-Orem area, and Provo already had a mask mandate, but the cases were increasing anyway. And at the same time, we try to ignore it, but Salt Lake County, even though it has more people, it does have just as many, if not more, cases than we do. And they have a mask mandate. So I guess what I'm thinking is, why are we, in essence, punishing the rest of the county for what a lot of students are doing? Students who don't feel at risk because they are at lower risk, if they get sick, they are at lower risk of hospitalizations. And we've seen that. The hospitalization rate is very low currently for this case uptick. And we're basically just trying to cover our butts because we don't know if the hospitalizations are going to go up or not. And we don't want people to blame us for, killing people, which is the worst thing you can do. I know that you guys were put in a tight spot, but, I'm in northern Utah County, like you, Tanner, and I don't feel like we're, as high of a risk, and I don't see why we should have the entire county being restricted for something that's happening in the center of the county, and the mask mandate that's already in place isn't even necessarily working. I want us to base our decisions on science and data. I'm a data analyst, but I don't think that this decision was based on science and data.
Thank you, Aaron. Appreciate your comment and participation. I actually would like to respond. I think you raised some great points. And I want to respond to you individually, but also because a number of emails and comments have been similar. I assure you that case counts, our tolerance is much higher than zero. The goal is not to have zero case counts. I have been one all along who recognizes the lack of logic there, right? We don't do that in anything else that we regulate. We don't have a zero tolerance. If we did, the speed limit would be 1 mile per hour throughout this entire state, right? And so actually we've had hundreds of cases for quite some time, and throughout the whole summer, even though we did not have a mask requirement, and there were many voices calling for one, even though we addressed it differently in Utah County, we did not have one, and Salt Lake did, we were not contributing disproportionately to the number of cases or to the hospitalizations or to the deaths. And so there was not data that suggested that we really needed to do this. And so that's why we didn't. And I indicated publicly that that's what I would be watching in order to support such a decision. And then sure enough, over the last few weeks, we did see this spike in case counts, like you're saying. And so now it was not one, right? That's not the risk tolerance, but a big spike. But even that was not enough. It was case counts. It was rate of positivity. It was the growth, right? And we were contributing 40% of the cases, even though we're only 20% of the population. We had 5.4 times the case rate. So all of a sudden, our county was disproportionately contributing, which is why the level of urgency, in my opinion, for us to intervene was high. And if you look at the health order, it actually ties this to data and metrics. And so, but you are right. I actually agree with your analysis when you said, we don't want people to die. We don't want it to be our fault. And we also don't know if the hospital utilization will go up. But it wasn't based on the cases. It was that when we saw the cases and we saw the rate of positivity and we saw the spread away from Provo and Orem, it was that the risk that our utilization of our hospitals could go up was high. Certainly increased from a few weeks ago or a month ago. And so we still don't know if that will happen, but that was the exact scenario that we were trying to prevent from happening. And I hope and pray that doesn't happen. That's why we intervene. And as we start to measure this, if it turns out that we're not even going to get close, we can back off of this a little bit. Or if it looks like, hey, this is working, whatever the case, we will continue to follow the data and make these decisions based on that. So really appreciate your comments.
Do we have a trigger for when we turn it off, when we turn off the mandate?
There is not an automatic trigger built into it. And so that's something I think we should have a dialogue about. It does tie a number of metrics in the health order that says we're going to measure those and base it on that. But we didn't identify what numbers, although I don't know if Ralph...
Because we've been decreasing in case count for 6 days now. So that's pretty good. It looks like we hit our spike and we're coming back down. But anyway, I would like to not have this be inevitable, indefinite. Especially if we want to base our decisions on data. And I mean, it looks like in Europe, there's increases in cases in Spain and Germany, but they're not getting hospitalizations or death. Sorry, I know my time's up, but I think there's a lot of things that we can compare and look at and realize that this could be, a false flag.
Thank you. Appreciate that. And just to also clarify, it's the order expires on October 20th, I believe, no matter what, but it could be rescinded or lifted earlier based on the data that we're tracking. So thank you for those comments.
Okay, next in the Zoom, we will go to Chantel Jensen, and I'll ask to unmute Chantel Jensen.
Hi, can you hear me?
We've got you loud and clear. Go ahead.
Okay. I just kind of wanted to talk about my children that have mask exemptions. And some may feel like that they are lucky because they have mask exemptions. But I feel like it's creating a huge divide for my kids. My daughter got pulled. I might get really emotional with this because my daughter got pulled by her backpack by a teacher and sternly asked where her mask was. And I feel like no teacher should ever pull on anything that is on their person for any reason. And my child's been in school for a whole term with a mask exemption, and all of a sudden she's getting pulled back and asked where her mask is. Her first day of school, she went in to one of her classes, and one of the teachers showed a video saying that it was something he had to do based on the state laws or something that he was required to do. And it was a video about why masks are important and how if you don't wear a mask, then you could kill somebody. And then he looked at my daughter and singled her out. And she is almost one of the only people in her school with a mask exemption. And I feel like you guys, I feel like Bill Lee made a very fine point when he said that we should be all working together and not dividing, right? And this mask mandate is causing a divide in people. I have a mask exemption as well. I walk into Costco and they are fine with me walking through, and then I'll go almost all the way through the store, and I always have someone come up to me and say, hey, did you get told to wear a mask? I let them know again that I have a mask exemption, but they always ask me, and you're not wearing one because? So I get singled out everywhere I go, and it's not fun. It's not okay. My own grandma is scared of my family because the fear that the government has put in to her to think that if we go anywhere without a mask, that we could kill her. We're respectful. We're not going to go get in someone's face. We'll be respectful of people's spaces. But to make it to where our own family is scared to death of us, that's not okay. That is a divide. My little sister is 16 years old, and she wore a mask all through her time going to work, and she started going to school and work, and now she's struggling to even concentrate because she wears a mask all day long. So I just want to understand where you guys feel like that's okay to create this divide in people. I feel like some responsibility should be taken on your guys' side too. That's it.
Okay, thank you for your comment, Chantel. The next...
Thank you for sharing your experiences, Chantel. Appreciate your comments.
The next comment will come from Cole Kelly. Cole Kelly is next. Listed as Stephanie Kelly, but I'm told it's Cole Kelly. Go ahead.
Hi, I'm Cole Kelly. I'm at parent-teacher conference here at American Fork High School tonight, so I don't have any parents. If I have parents come in, then I may have to leave you for a period of time. But I think the data is important to consider, and I want to just share some numbers that you yourselves tonight have shared. You said, all right, Utah County has 40% of the cases and only 20% of the population. We also only have 11% of the hospitalization rate in the state. The other night on Monday, I went to the health board, county health board meeting, and I asked Executive Director Ralph Clegg. I said, Ralph, what is the goal of the Utah County Health Department? And his answer was flatten the curve. At the beginning of this pandemic, I was happy to work with everybody to flatten the curve so we don't overwhelm our healthcare system. Currently in Utah County, and this was according to Mr. Clegg at the meeting on Monday, we have 95 hospital beds, and only 51 of those, these are ICU beds, so we have 95 in the county, and only 51 of those beds are being used. We just learned that the case count over the last 6 days has gone down. So when we're looking at data, it seems to me that the only number that we continue to look at is cases. Are we looking, if we're trying to flatten the curve so that we don't overwhelm our hospitals, are we looking at the hospitals? And Mr. Ains, you just said, we don't know if the hospitals are going to go up. So what you're telling us is that you're willing to mandate something based on an unknown number down the road. So you're going to force me to do something when you don't know. I think it's poor. I think it's poor judgment. I think we've got to make decisions based on what we do know, and we do know that there are still lots of hospital beds available to residents of Utah County. That's all I've got.
Really appreciate your comments. A couple of responses there. I think that you're right, and I respect differences of opinion, and I will stand by that. We don't know for sure, right? But if I have people at the state indicating that the possibility is high, right? That's what we all have to do in our lives, and that's why I respect differences of opinion. There's risk management, and that felt heavy on my shoulders when the state started giving us the data of the possibility increasing of an overwhelmed healthcare system. I think that's the risk that we have to weigh, and are we willing to take some action to make sure or do our best to try to prevent that? But then your other comment about hospitalization, the only other thing I would say, because I think you make great points and you have data, and this comes up a lot too, is what the state task force will tell us is that we have to manage our hospital system on a statewide basis, certainly along the Wasatch Front, because we're not in isolation here in Utah County, because if you get sick in American Fork, you could easily be transferred up to Sandy, or Draper, Murray, same thing. They could transfer people up here. We don't have these clear boundary lines in the way our hospital system is managed, and so we have to be.
How many people are being transferred for COVID?
I don't have that data directly, but I don't know if Ralph could speak to that. But I do know that that's just what the state tells us when we're looking at hospital data, is they have to look at a broader, geographic area than just where county boundaries are.
So you're making a decision on something you don't know. But see, that's where the struggle is. We should be erring on the side of freedom. Okay, this country was built on that idea of individual freedom, and we continually are erring on the side of mandates and government control and government decisions. Mr. Clegg said to me on Monday that we're not shutting down opportunities. I disagree. I had half of my students on Monday and Tuesday. I had the other half on Wednesday and Thursday. While half of my students are staying home 2 days out of the week, the other half staying home the other 2 days out of the week. And you know, as Allie mentioned earlier, she's a parent that works, and it's hard for, you know, what are your kids doing during the day? Do you know what your kids are doing during the day? Not everybody has the luxury to stay home and know what their kids are doing throughout the day. And I know that education isn't a babysitting service, but at the same time, you know, we're making these decisions. We've got to consider the educational value. We've got to look at that as a public health issue. Is not education a public health issue? I think it is. Is teen suicide not a public health education? Is that not a public health issue? You're only looking at case counts. You're only looking at case counts and not considering all the other factors that should be considered when we're looking at the health of our teenage kids.
Really appreciate your comments. Thank you.
Okay, we have another comment on Zoom that comes from somebody who has called in from a phone number that ends in 3747. Please identify yourself once you begin your comment. I'll go ahead and unmute you now. Phone number ending in 3747.
Hello. That's me, I believe. Can you hear me?
We can hear you just fine.
Okay. So my name's Deanna Holland. I was very vocal when this mandate happened, and Tanner actually called me a couple of days ago. And we had a conversation. However, that conversation ended without me feeling like there was any sort of consensus on when this was going to go away, how we were going to tell when this was going away, or really a heavy look at the other consequences of a mandate like this. When we're doing it based off of possible numbers, you know, we aren't looking at all the other problems. I have a friend who has a condition, and she was forced to wear a mask because at state buildings there are no ADA accommodations anymore. I never want to go through that again, ever. I have a daughter who she's in college. She's taking her college classes and had a job. She was wearing a mask all summer, 11 hours a day in the blazing hot sun. She just got a job in the industry she's studying, and she has to have that job in order to get her certificates. And she was very excited that this job had no mask mandate. And she got this job 2 days before your mask mandate. And now my daughter will be masked 14 hours a day. You know, I'm the one that has to deal with the consequences of this for my child. You know, I'm done. I'm done with the government thinking that it knows better than I do on how to protect my family from this illness. I'm done with you thinking that we want you to protect us at all costs. I don't. I want my liberty. I want my freedom. And I'm just letting you know that the silent majority that goes along with this mask mandate, now that I'm being vocal, they're almost done. They're telling me they are almost done. You took me, who was very compliant at the beginning. When I started seeing that the things that we thought were going to happen didn't happen, I realized that this is all about political maneuvering and fear and control. And government never gives control back. Government doesn't want to give control back. And the fact that we're doing this because the state says or because the governor says, you know, I don't want to do what the governor says. The governor has mandated children wear masks all day long, and I see the effects of that. And so, you know, our hospitals are not almost full. In fact, I haven't looked it up because I was going to look it up for my meeting tomorrow, but the normal ICU rate is, they don't want our ICUs not full. I don't even believe our ICU rate is even really above normal. So why are we stressed? You know, when this first happened, we thought we were going to have, you know, build another ICU on a floor of a hospital. Well, we could do that still. But the truth is, when I look at the numbers and I look at the data, I don't think that's going to happen. All over the world, you know, case counts are rising and hospitalizations are going down. So this is a fabulous time of year in October before the cold and flu season to let us, those that are healthy and at college and showing no symptoms, let them get it. It's okay. And the fact that we think that on October 20th that this is going to magically go away if the case counts get lower, well, that's ridiculous. We all know that testing is practically a farce. and that we're heading into the flu and cold season. So why do we think that I have no hope? I literally, unless we can put enough pressure on you and the health department, I have no hope that this is going to go away, because I can't get numbers from anybody. When does this go away? What hospitalization rate is okay and which one isn't? You know, there's nobody telling us these data-driven things. I hear you say it was done with data, but I look at hospitalization and we are fine. You know, and I look at what's happening in here and around the world, and I'm not worried about hospitalization rates. I could be proven wrong, but I'm more worried about the people that are affected every day. Why was my daughter's new job now mandated? We haven't had any outbreaks there. That's a job where they can safely be unmasked, and now they're mandated. These top-down things do not work. We need to be given the freedom to choose.
Time. The 3 minutes is up. Thank you.
Okay, to choose for ourselves and our businesses what works. No business wants their employees to be unhealthy, but they can decide. They can look at their business and decide, I don't want any of you telling me what to do anymore. I'm done.
Thank you.
Okay, there isn't anybody else online who has raised their hand who has not already spoken at least once previously. Is there anybody else that is new, that has not commented, that wanted to comment, that hasn't yet raised their hand? We do have a hand raised from the conference room, so I'll check in to see if there's something with the overflow. While we're doing that, I'm sure we could take.
Okay, you can comment here.
Hi, my name's Ezra Nair. I work in the Office of Commissioner Ainge, but just wanted to share my concerns as a resident of the county and of this country. And I just kind of want to speak to both sides of people who may be watching this who might not understand how people can take something that they think is as simple as just wearing a mask, how they can have such an emotional reaction to that. And I think it has a lot to do with where we've been this entire year. This entire year has been a crazy one for all of us, and it's been a long time since we first had those lockdowns back in March. And what some people think is just, oh, this is just one more thing that you can do. It's not that hard. A lot of people take that decision and those mandates in with what they've been experiencing all year. And so I know it's easy to maybe laugh at some people or think they're crazy, but everyone is just trying to live their lives and make the decisions that they think is right for them. And so I really appreciate the cordiality amongst the commission and making decisions and trying to really act and do what they think is right, even if they disagree. I think that's really important. And after watching the presidential debates last night, like, I just want some open conversation and ability to disagree with people openly and not always assume that everything is in the worst interest, because I think most of the time people are good. So thank you for your time. Appreciate it.
You.
Okay, we do have a number of hands that are raised in the Zoom conference room, so I'll resume that.
We do have other agenda items, so are we going to say you can come back to the queue, or should we just say that those who are in there now, and is there a time limit?
So that's up to you. There are 3 additional hands in the room that have not previously spoken, but that just raised their hand recently.
Oh, no, those are, let's take those, is my
Okay.
opinion, for sure.
Okay, we'll go with the individuals who have used their full name. If you're in the Zoom room, please edit your name. I'm gonna allow you to edit your own name. please put your name so that we'll know who you are. There's like, for example, iPhone. So I don't know who iPhone is, but I'm going to enable the ability for individuals to rename themselves. Okay, we'll go with Skylar Jensen. Give me a second. We'll unmute Skylar Jensen.
Can you hear me?
Okay, Skylar, we've got you.
Hey, thanks for hearing us. There's a lot of people that want to talk about this. So, as I've gone to different commission meetings and stuff, I've noticed that the people backing up all this mask mandate stuff is getting lower and lower. I haven't really heard of anybody on the mandate side saying anything. Is that weird to you, or are you noticing that people are getting tired of this and we I think are done? No matter what you do, I think you've got enough people now that are done that it's not really going to do anything. So, just curious how you feel about that.
Thanks, Skylar. I'm certainly happy to comment on that. I think that, certainly like on this call, there's more people voicing concerns with the mask requirement. I don't really know of anyone who enjoys wearing a mask. I certainly don't. But we do get a lot of support and encouragement and angry emails. Even when we didn't have a requirement, we heard from a lot of residents who thought that was irresponsible. We were continuing down that path, following the data without having one. So personally, I do hear from a lot of people on all sides of this issue. And for whatever reason, which is not a surprise to me, it never really has been, those who choose to participate in this forum or attend our meetings is not always representative of the county at large or those who reach out via other means. So, but appreciate your comments and questions.
I just wonder why it's never been an option or even something to try out, like just letting people make their own choice of whether they want to or not. Because I don't have a problem with people wearing a mask or even wearing it wrong. It's more of a choice thing. If you choose to wear a mask, that's great. But if I choose not to, or if I can't, I shouldn't get ridiculed everywhere I go. I think maybe you guys should try that and see how that goes. Since obviously masks aren't completely slowing the spread, like in Provo, we're seeing that. Why don't you try and let people have a decision on if they want to or not, and then gather some data on that?
Thank you. No, appreciate it. One piece of data that hasn't come up is that, certainly that has been the case. We have not had a requirement in place the entire, from the beginning of this all the way through the end of summer. So that has been our position. And quite frankly, the data was suggesting that we were doing just as well as Salt Lake County. Now we see this spike, and there was time to act. At least that's what we were willing to do or felt like we needed to do at the moment. But
did you ever think that the mortality rate is not jumping up with the cases? So obviously something's being done right. I'm thinking the more cases that happen, the closer we are to herd immunity, and we don't need a vaccine, and we can move on with our lives. So if you're not having high death rates with high case count, I think we should be happy that not a lot are dying, and we're getting herd immunity. So I don't see where there's like a disconnect in seeing things that way.
Thank you, Skylar. Appreciate your comments.
Okay, next in the comment queue is Kristen Chevrier. Going to unmute Kristen.
Okay, can you hear me?
We can hear you great. Go ahead.
Thank you. I have two questions and one comment. And I'd love to have answers or a promise to find the answers. The first question is, why are we not employing prophylactics and therapeutics like hydroxychloroquine, zinc, azithromycin vitamin D, and I sent each of the commissioners some studies that just came out in the past few days on the effectiveness of vitamin D and also vitamin C. Why are we not pushing those instead of pushing the things that are not really working, like the masks and the social distancing and all of that? So that's one question. The second question is, which company is doing the testing? And is it PCR testing? And if it is PCR testing, how many cycles is each sample being put through? And is it a standard number of cycles, or is it different depending on the situation? And as part of that question, until we know the answers to those questions, we really don't know anything, because we don't know how stretched the testing has become. If you're going over 33 cycles, then you're digging into past history and you're not even testing the current infection. And then I wanted to point out also that the reason you're seeing a spike in Utah County right now is because Utah County is the focus of the entire state. We have been pushing students to get tested because they can't come back to school unless they're tested and they're clean. We have been pushing employees to get tested. My daughter, as an employee at a nursing home, is tested twice every single week. Every single week she's tested twice. That is ridiculous. There's not even time for the test to come back before she's being tested again. And then they just told her because she has a sore throat, she can't work for 14 days and they're not going to pay her, even though she's tested twice every week. So when you test, I don't know why this hasn't become clear yet, but when you continue to test and coerce and push people into being tested before any medical procedure, before they can work, before they can go to school, all of these things, if you test more, you're going to have more cases. It's just a fact. So why are we surprised when Utah County has been the focus, and because we have the two largest universities where people are coming back to school, why are we surprised that we have a spike? And those are my questions.
Thank you, Kristen. As Ralph Clegg comes up to address a lot of the technical health questions, I know I have one response on the testing issue. I think you're exactly right. I asked those questions of the state task force when it comes to if you push testing, if you have more randomized testing, more required testing of people without symptoms, that's certainly going to drive the cases high. That's why we don't look at cases in isolation. We look at all of the data. So what's interesting is if you're just driving up cases and you have a lot of people, especially those without symptoms, being tested, then you would expect that as cases rise, you would see a decrease in the percent positive rate. But in Utah County, we're actually seeing both. The cases are increasing, and so even though we're testing more, we're still having a very high, much higher than the rest of the state, percent positive. So it's those two things in combination that reveal a concerning trend. But I appreciate your points.
You can answer part of the reason we have so many positives if you can tell me how many cycles we're putting each sample through.
Okay, thank you. And Ralph Clegg has taken the podium, and he's going to respond to some of the more technical
Thank
questions.
you.
Thank you. Well, the hydroxychloroquine that you mentioned, initially there seemed to be some studies that would indicate that may be effective against the virus. But since then, those studies have been, debunked by other studies that indicate that it really has no effect on the virus and actually can have
that doesn't account for all of the hands-on experience that's happening right now across the country.
Well, again, this is not I'm trying to give you some information. It's not a time to debate the issue. And as far as, the other things, certainly the more things that can help you boost your immune system, if they help you boost your immune system, certainly that's going to help you against any virus or any other disease there might be. As far as the testing, you indicate your daughter's tested twice a week. I thought you said that she's in a long-term care facility. Those are requirements by the Center for Medicaid that they require, because that population is the most susceptible to negative outcomes from this disease. And so they're trying to be very careful and make sure that if somebody is infected, that they can get out of that setting so they don't infect the residents there. Now, there are hopefully some testing coming out that will be a little more rapid so that they're not having to wait a couple of days for testing results. I think you'll see that as this continues to roll out. There's a lot of changes coming to the processes as we learn more about this disease and as testing improves and as opportunities for us to learn more and science to learn more about this disease. But I appreciate your concerns and thank you for sharing them. I think those are noted in the record.
So vitamin D and vitamin C and zinc and azithromycin?
Well, again, anything you take that may boost your immune system, such as a vitamin, was probably it can be helpful as long as you don't take more than you need. Azithromycin is a medicine that's for bacterial infections and not for viral. There is no medicine that's been approved to be used for this virus, other than there are some if a person is very sick and in the hospital, there are some anti-inflammatories that seem to be helpful for those individuals. And so those are being
Could
used
you
in hospitals.
please look at what's happening in Texas and several places across the country where they're using these things with incredible success? Why are we ignoring the data that's coming from the rest of the country?
Well, I don't know that anybody's ignoring the data. I'm sure the state health department, who has the staffing levels to look at those kinds of things, that they're looking at that and will continue to do so. Guidance is really taken from the Centers for Disease Control. They have the expertise in this field. They do the analysis. They have the directions that are public health directions and are looked at as the experts. I don't think anybody knows everything. It's a new disease, and we'll continue to learn.
Can you address the testing? Which company is doing the testing? How many cycles is each sample being put through?
You know, the testing is under the direction of the state health department. I'm not aware of how many cycles they use to do the testing. I know that the testing
Are you curious?
I know that the testing meets all the requirements of the Centers for Disease Control in order to be counted as a positive test.
Okay, would you mind asking them and then reporting back to the county commission on how many cycles each sample is being put through and who is doing the testing?
Well, the testing is done at certified labs throughout the state, so and even now they're contracting with out-of-state labs to try to deal with all the tests that are coming in. But I can ask the question about the cycling. It may be better if you ask that directly to the state yourself, but if you like, I can certainly ask that and see if I can get a response.
Thank you, that would be wonderful.
Appreciate it, Ralph. Thank you, Kristen.
Okay, commissioners, we have, let's see if we've got any other hands up. I'd encourage anybody who, had additional things they wanted to say who had already commented. There is the chat feature in the Zoom, which I've opened up, so I suppose if you have additional things, you could also place it there. But we don't have any other comments that haven't already at least made a comment previously. But there is one previous commenter that would want to continue to comment, so I'll leave that up to you.
Let him comment. One more.
Happy to have one more comment,
Okay.
and we'll close the comments.
Okay, this comment will come from Laura Hackey. Laura, would you like to use the conference room overflow mic? Well, I'll open up the laptop in the overflow. If you're still in that room, if you want to use that forum, otherwise I can open up your, there we go.
That's fine. Thank you. I appreciate it. Thanks for giving me some more time. I just wanted to say, Another thing I'd like us to look into before doing any kind of mandates is that's what I did last year when I had cancer. Oh, yeah. How do I do that? That's what I did when I had cancer last year. My
Laura?
doctor had me. Yeah?
Really quick, we lost you for about 5 seconds, and so we didn't hear what you said you did prior. So if you could just repeat that.
Sure. Yeah, thank you. So I'm just requesting that we look into some other options, like having those that are at risk or afraid shelter in place. Last year, when I went through breast cancer, I went through chemo, and my doctor had me be careful or shelter in place, even though any virus or even a fever of 99 would put me in the hospital, and I could even die. So he just had, and I taught a class at Westfield Elementary, but he didn't have them into masks. Instead, he just had me be careful. Same with my neighborhood. They didn't have to wear masks. It was just my own personal responsibility for my own health to be careful. And I'm a single working mom, so I kind of feel like if I, a single working mom, is able to do this, and it's not easy, but it's something we can do. If I, a single working mom, can do it, I think any adult can. So I'd like us to be able to look at that as an option, as we're also looking at, how we analyze the case and cases and the case data and who's doing the analyzing, just more scientific information, so that we're making sure we're listening to all of the doctors and we're listening to all of the options that we have, and we're listening to all of the data that we're gathering and who's analyzing and making sure that those are the most qualified people to make these analyses. So that's, I think before we do any mandate, a little bit more information and science and study needs to happen, including the study that was mentioned earlier about some of the more rural areas of Utah County that are not being affected the same way as maybe Provo and Orem. So I just wanted to add that. Just more information for us to look at before doing anything as drastic as a mask mandate.
Thank you, Laura.
Thank you.
Mr. Chair, I'd like to make some comments kind of on the final, since that was our last one. First off, and unfortunately Ralph Clegg left, part of the frustration comes in when we have mandates like this is that there's no measurement. We're talking about science and data and so forth, but there's no data on the other end. It's left wide open. And I asked Ralph point blank, I said, what are we trying to get out of this? What are we trying to measure? What are we trying to do? Where are we trying to get to? Where's the measurement on this thing? And there's no response except for, we just want to get things down. We just want to go in this direction. It's frustrating to see that kind of disregard for having a population go in a direction when there's no end zone. Because what happens is it turns into, this will go on forever. We've already been through 15 days, 14 days, 15 days to flatten the curve. And how long are we still in this? How long are we still talking about that? How long is the flatten the curve going before it transitions into something else? It becomes very problematic when we don't have measurements in place that says, when we get to here, we will be able to do something. There's no plan. There's no plan. It's a problem. Second, I want to tell a personal story. My father has 4 possible life-taking health concerns. At the very first of this year, he was in the hospital, as you're well aware, and we didn't know how it was going to go and what was going to happen. And so we were going through this, and then this COVID hits. And we're scared to death. We didn't know where he was going to be at. He was offered to go on hospice and all kinds of other issues there. And so we looked at the challenges that were going on, and all of a sudden here comes COVID, and he goes into a care facility. And while in the care facility, they wouldn't let my mom in there. They wouldn't let us in there. We had to knock on the window and wave through the window. People know what's going on with this. What I'm trying to get at is there are consequences to things that go on, but this one here is choice-based. And so he sat in there for a while and finally called up and said, "Take me home. I'm done. I'm done with this." And we said, "There's risk." And he says, "I know there's risk, and that's a risk that I will take." And so we brought him home. And then the next question was, "Dad, do you want us to mask up?" And he says, "You know what? I've lived my whole entire life for my family, and if this takes me, so be it." It's only one of then 5 issues that he has to possibly take his life, and so I applaud him for that. Of course, we wash hands, and stuff like that. We do that when we go over and see him. We ask about masks. He says, "No, we're not gonna do that." Again, his choice. He made a choice there. We respect him. And I have a neighbor behind me who says, "Wear a mask." I'll wear a mask. I respect that decision. If she says stay away, we'll stay away. We'll go get groceries for her. Let her chickens out. We'll do all those kind of things. But we're in a place now where government is saying, this is what we're going to do. There's no measurements to it, and we're going to stay in this for 14, 15 days, and we're just trying to flatten it, but there's no horizon to it. It just seems to go forever. Last, and I'm gonna read this one because I told her I would. I'm not going to read her name because, and she said I could, but I'm not going to anyway. She says, As I've been watching the news recently, I've seen an uptick in COVID cases. I understand that this is a concerning trend to many that are elected officials across the country. Let's see, hang on. I think this has moved on. Across the country, and are meeting to discuss additional measures that may need to be taken. It is with concern over this matter that I write you today. I am a mother of children who were born extremely premature. One was so early that she is now buried in the Provo cemetery. 2 have long-lasting health effects and are under constant considerations, as we all do. I have been since the beginning of the pandemic in China, where concerns with how this would all affect them. Their lungs are extremely fragile with respiratory illnesses, along with several other underlying medical conditions. I have a son especially that can easily end up hospitalized over a case of common cold, RSV, or the flu. I have pored over studies, met with medical professionals, and prayed more than I have ever done before. Through these readings, discussions, and reflections, the general consensus is that wearing a mask for a prolonged period of time would be extremely detrimental and possibly life-threatening to my son. No matter what I do, I cannot control how often he touches his face, exposing the more vulnerable parts of his body to not just COVID, but also to any other virus or bacteria that would be present on his skin. Studies have shown also that bacteria begins to grow in a cloth mask after about 20 minutes. The lungs infections are popping up everywhere as a result. Putting him in a mask could lead him to very serious side effects, and I am thankful for the choice we have to this point had. That being said, I want to make it clear, this is not a political statement. This is not a denial of science or a call for ultimate freedom. This is not me asking others to do extra work to protect me or my family. We are willing to do the work to protect ourselves and respect the rights of others who do what they feel is best for them. We have dramatically changed our lives since March. The children go nowhere. That masks are required. No school, no grocery stores, nothing. They have given up time with friends and well-loved lessons and activities in order to respect private property owners who require masks. We work hard to temperature and symptom check constantly, sanitizing, social distancing. We are in and near constant contact with the doctors who understand our unique circumstances. We are not disrespectful of the virus or the feelings of others, and we try hard to balance the mental, spiritual, emotional, and physical health of each family member as we work through these tough times. This is simply a plea from a mother who is trying to protect her son, a prayer that you will consider each constituent in their overall challenges as we work together to navigate through this. That you will consider that the whole person and their well-being in every aspect, not just COVID. That you will remember that COVID is not the only way to become ill or die, and that we are still facing challenges other than just this single virus. Please, please, as you consider mandates and new rules, consider the thousands like him. There are those who may be harmed by further actions such as mask mandates, lockdowns, and closures. Please allow those who may have legitimate concerns and reasons and choices the ability to protect themselves without being a criminal. And so, simple statement that she has, very concerns that I can see and feel in there. And I think that as we consider this, there's ripple effects that happen across our county. Some of those ripple effects, affect others in dramatic ways. And there's a lot that goes on the mental, like she says, mental, emotional, spiritual, psychological, and so forth cases that are happening that we never seem to refer to. And so with that, I am concerned. Again, I think masks and the mandate is probably the lowest form of compliance, to it, and the higher forms are done with education, with information, and with opportunity to know where and let individuals make choices based on their own circumstances, just like my father made his choice, which we just celebrated his birthday, and I never thought that was going to happen this year. But he's made his choice, and I know that if COVID was the fifth one and part of that whole health issue, he would probably still say, I'm fine with the decisions I've made, because I see some people and I see them when they're locked away, and I can tell you now, if he would have been in that rest home or in that care facility, he probably would not be here today. And so, anyway, with that, I hope that we'll consider the whole county, the whole issues, respect those who want masks. I actually choose to wear masks in situations. I've done so, and I do it on purpose. I choose to wear a mask where I think it's appropriate to wear that mask, and respect others, and I'll continue to do that. And hopefully we can find a balance, and the balance is not just one-sided or done with fear and force, but is done with cooperation and information.
Appreciate those comments, Commissioner Lee. Well stated by you and that author. I think that it's also, I think that we've all tried to listen to these stories, and the author of that letter used the word criminal, and we have not criminalized this in our county. So I think that's important to point out. And also, there's a number of exceptions that are built into all of this, and situations that's certainly not going to be enforced on anyone in their family gatherings and in their home. That's pretty clear as you read the order and the letter that was issued by the commission. But I certainly think those are great points that are made.
I think that's a hope, but the problem is disobeying a public order is a Class B misdemeanor, no matter what. Even if we say we're not going to, we're not going to do it, but it is a Class B misdemeanor to disobey a public health order.
Okay. And on the data as well, I would say it is important to have a goal and have measurements. The state health department has given us many of those. We will continue to track to those. I think we should have a meeting with the state task force prior to the expiration of this, as we track the data and we begin to see how we're doing as a county. That's something we're all tracking. We still have a weekly call with the mayors. Ralph is working on getting better county-specific data and zip code-specific data. So that's something that's in the works and that we are monitoring regularly.
So Ralph, what date are we looking at for possibly early release of this? I mean, so many counts, so many case counts, hospitalization rates. Where's the measurement? sides to go back to the yellow, and I think there's no reason not to have that. So we have most of the county in yellow.
There are a number of benchmarks for case rate, infection rate, positivity rate. You know, these types of things that we can go back to see, are we still contributing a disproportionate number of shares? I agree with you. Let's set those in stone. Let's develop that dashboard. We already have a directional dashboard that the state health department kind of guided, and we wrote in the metrics that we're going to look at, but we did not hard code in the level those metrics should be at to be lifted. And so I think that's an important conversation that we're going to continue to develop. And so I like that contribution from this meeting, and I'm committed to doing that and working with the state and our county health department to put more direction around that. I think our residents deserve that. I've been frustrated as well at times that we all want more data. I tend to think that everyone is doing their best here with limited information, tracking a new virus. And yet it's still frustrating. We want more information. So I appreciate that contribution to this. And with that, unless Commissioner Ivey, I know it's harder for you because you have to get invited to unmute, so I don't know if you have comments. I would also entertain a motion on this ratification.
You know, no, not really much additional comment. Again, I appreciate Commissioner Lee's comments, those who have spoke to us from the public. In echoing Commissioner Lee's comment, we all have to make choices. The other day I made a choice to keep our county out of orange because I felt like this was the lesser of two evils. And I look forward to this expiring quickly as our case counts, our positivity rate, and the percentage of the state cases gets back to where we were prior to our spike.
Okay, thank you. I'd entertain a motion.
So I'm guessing, Commissioner Lee, you're not going to make a motion on this, or
No,
you want me
no,
to just
no.
do it?
No, go ahead. I'll let you two run through the process.
Okay, I will go ahead and, sorry, Commissioner Ainge, I'm looking on my agenda. Can you remind me the number again?
Consent agenda item number 28.
28, there we are.
Wait.
Sorry,
This is
just
regular
going through that.
agenda item number 35,
I'm
which is
looking
a
at the wrong-
ratification
the wrong-
This is
action.
35.
Yep, regular agenda 35.
There we go. Sorry about that. I just, on the digital one, I was trying to scroll through and couldn't see the number. So I will move that we ratify regular agenda item number 35.
Okay, I will suspend the rules and second that motion. We have a motion and a second. All in favor say aye.
Aye.
Aye. Any opposed?
Nay. Or aye.
So regular agenda item number 35 is approved with a 2-1 vote with Commissioner Lee as opposed. Okay. We now turn to setting closed meetings. I know we need 36. I believe that's the only one we need.
I think we need
We also need number 39.
to set that.
Oh, so do we need to set 39 for tomorrow? Okay.
Yes.
And then 36 for immediately after this meeting? Okay.
I'll make a motion that we strike regular agenda item number 37 and 38.
Second.
Sorry about that. I'll second that.
Okay, we have motion and second to strike 37 and 38. All in favor say aye.
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 Passes 3-0.
I'll make a motion that we approve and set a date, time, and location as stated in number 36. And also approve and set a date, time, and location, which the date is Thursday, October 1st, 2020 at 3 p.m. for item number 39 at this location on Thursday, on October 1st.
Sorry, did you say 3 p.m.?
I'll
I I have 3 p.m.
I have it on my
Yes,
computer.
that's correct.
Oh, is it 3?
That's correct.
Okay.
3 p.m. is accurate.
Okay, great. No, that works. Okay. Do we have a second?
Second.
We have a motion and a second. As stated, all in favor say aye.
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 Okay, we'll now move into our closed meetings. Thank you.